I will call the meeting to order. Let's have the Pledge of Allegiance, please.
Peggy, can you hear us online?
Oh,
Tim?
oh, I'm sorry.
Anybody? Okay, thank you. I think we're good.
Jessica, what's the word?
I think we're good.
Okay. All right. Let's have a Pledge of Allegiance, please. I pledge
allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
So Jessica brought to my attention that we need to amend the agenda slightly. So if you go to item 11, the executive session, so it needs to be tweaked a little bit.
That's on the minutes, item 11.
No, that's on our agenda for today. This is today's agenda. Rather than 74206-1B, it needs to be 1A. Is that correct, Jessica?
That's correct.
Okay, so that would be the First Amendment. They're allied, A and B. It's just one of them is kind of a positive, uplifting discussion, and the other one not so. This is actually a positive, uplifting discussion. And then Jessica pointed out to me that you need an action item to go into executive committee, and then you need an action item to come out of executive committee. And I didn't do that, so my bad. And then there's an action item on the PIO hire, which is the very purpose of the executive.
Chairman, Tim does not have sound.
Oh, well, we're not ready. Can anyone, yes, sir?
Would it be proper to ask if you guys could switch number 11 and put it after 14 for the people that are visiting here that wouldn't have to wait out in the hall while you guys have your executive session?
I am sensitive to your request. Thank you, Commissioner Corn. Oh, I guess as soon as we have sound, I'll advance your request. I think it's a perfectly reasonable request. In fact, you guys customarily do that.
Yes.
You always put your executive session at the end so that people in the public don't have to wait around. I get it, and that's civil. That's polite.
Mm-hmm.
Tell me when. One of these days, when I get the nerve, I'm going to ask you guys, why is it that the sheriff's requests always go into executive session? You don't have to answer. No, okay, exactly.
Oh,
I'm sorry, I can't help myself.
Okay.
it's true.
Peg. Okay, we're back online.
Are we
We're
back
good to
on?
go. Yep.
Peggy as well.
And Peggy as well. So Jessica, do I have a green light?
Peggy, can you hear us now too?
Yes.
Yep.
Okay, so another modification of the agenda, actually at the request of Commissioner Corn, and that is to place item 11 at the end, say after 13 and before 14. Or Eric, do you want to leave also? No, put it between 13 and 14. That way, the people in the public can leave, or for that matter, the staff can leave because the meeting's almost over. So those are the three amendments to the agenda. Do I hear a motion?
A motion to move 11 to after 14. So we'd shift everything up. 12 would be 11, 13 would be 12, 14 would be 13, and 11's basically 14.
And then there were two other things that we.
Oh, we're doing the
requested.
A,
In
you
other
mean, as
words,
well?
an action item to come out of,
And to add the action item come out of, and to, do we have to do it to amend the B to A?
and make it B to A,
To
correct.
amend
Make it A
The
instead of B.
executive session from a B to an A.
Correct. So we have a motion. Do I hear a second?
Chairman, I second that motion.
Any discussion?
Mr. Chairman, we need 12, which Ohio behind 11 is
Oh, very good. Thank you, Doug.
Thanks.
Dr. Nolan,
Yes,
that's
I
a
amend
friendly
my
amendment.
motion to also move 12 down after 11. So 11 and 12 are moved as a joint thing to after 14. Does that sound good?
Okay. You accept that as a friendly second?
Yeah, I would second that motion.
Okay. Any further discussion? Hearing none, roll call vote.
Glenn Bailey,
Yes?
Peggy Cavala,
No.
Dr. Johnson,
Yes.
Dr. Noland,
Yes.
Commissioner Bertling,
No.
Chairman Fletcher.
Yes. Okay. Thank you, everyone. Public comment? Public, anyone want to? This is your moment. All right. Hearing none, we have the consent agenda. Are there any extractions of the items within the consent agenda? Hearing none, then I will entertain a motion to accept the consent agenda.
A motion to accept the consent agenda as written.
Any second?
Chairman, I second that motion.
Okay. Any objections to passage of the consent agenda? Any objections? Going twice? Going three times? Okay. Jessica, will you please have the minutes, please reflect that it was a unanimous adoption. Next item is number 6, the bylaws modification. We have we have proposed bylaws changes, and tab 3. Here we go. And there was a vigorous conversation at the last board meeting over one specific section of the bylaws. In fact, 98% of the bylaws are in fact bylaws. I mean, they're not even a change. It had to do with the term Nuremberg Code, and I believe that Dr. Nolan had some thoughts on the matter and made a modification pursuant that last conversation. And if you go to the proposed changes on page 26, you can see what is before you. Dr. Nolan, do you want to take over?
Chairman Fletcher, we also have a hand raised online, just so you know.
I'm sorry?
We also have a hand raised online for
Peggy has her hand
discussion.
raised.
Oh, yes, Peggy?
Well, Dr. Nolan can finish, but I have several comments to make.
Great, thank you, Peggy. So the idea is to put in the section of risk benefit analysis for any procedures, which would be any medically related procedures going on, be they preventative or interdictive or treatment based. So it's more of a standard medical term, where we're also putting in that this includes informed consent, the ethical and legal process whereby a healthcare professional educates a patient on the risks, the benefits, the alternatives of a procedure, enabling them to make a voluntary, informed decision without coercion. And so that's a very typical standard requirement. It's actually a requirement of any practice of medicine. So we're just putting in there that that's something that we, verbosely say that we're going to be adhering to. So now I know that there's been concern about that, and the concern is who's determining what education gets presented, right? And so that's kind of the main concern that is in when there's different camps. There might be 2 camps or 5 camps or 20 camps. But all of them are like, well, who's actually determining what are the risks and benefits and what are alternatives? And because some people might think there are no alternatives. Other people might think that there's 2 alternatives. One people thinks, well, no, there's only one. So there could be a lot of discussion back and forth on the subtopics of all of this, but it's a very extremely standard requirement for medical. In fact, if you're not doing that or not documenting it, a lot of people's malpractice probably would not want to continue being your malpractice. And so it's kind of like when we talked with Idaho Risk Management about their standards of basically, staying in compliance. This is just a typical standard of staying in compliance with medicine. And since there are malpractice provider as well for the clinic, then this is something that would be considered normal. And I know that there'll probably be discussions, which are good to discuss. And ultimately, I think it determines on whether or not someone personally agrees with what is being presented as a risk or not a risk, or if they feel like the risk is being overblown, or if someone else feels like the risk is being underblown, or so like that. So it kind of goes both ways. And so I'd love to hear, Peggy, I'd love to hear what your thoughts are on that.
Well, I don't have thoughts specifically just to that, but I actually would like to see this item removed from the agenda due to lack of background information to make an informed decision. There are several items on the agenda today that.
Peggy, could you let me know what the background is needed for it?
Let me finish, please.
Okay.
Okay.
Let's just stick with this item, Peggy. If there's other items, let's just stick with this one. We can pick up the other items later.
I will speak directly to this one at this point in time.
Yeah, that'd be good.
May I continue? I requested background information on this item over 30 days ago, as well as I have requested medical committee minutes multiple times over the past 30 days. I was told that the medical committee minutes would be a part of the board packet by Chairman Fletcher, and they were not. So now as a board member of this board, I have had to complete a written record request to receive info that should be readily available to all board members in order to make informed decisions. So at this time, I would request that this item be tabled.
Peggy, what written request are you referring to, just so I understand?
I have submitted a written request for the medical committee minutes.
Is that like a FOIA request or just like, hey, can I get this?
I don't know what you mean.
Okay, so
are you
my
asking if it's
thought would be,
formal?
Peggy, when the first reading of this occurred, that was something that Thomas presented at the chairman presented at the meeting. There was no minutes on that. I had not seen it before. He had not told me about the content of that before. I saw it when you did because he presented it. And so then I read it, and then it made sense to me, and I discussed it. So that was not a minutes meeting type of thing. And so this is a revision because you and I had a dialogue, I think fruitful last time. And so this is basically a result of our dialogue that we had at the open board meeting. And so there hasn't been any like debating on this before. This is basically more or less the wording that I spoke to you in person at the open board meeting. So what I'm wondering is, for this specific topic, what is your concern?
Well, I think there's this has been presented as a simple change, but I think it's not just a simple change. I think the changes to the bylaws are quite significant.
Okay, that's
And
fine. I know
again,
you've said that, but I would like to know why do you think it's specific? Why do you think it's significant? And what exactly about it do you think it's significant? Because that's really the critical part, because you keep bringing up that you think it's significant, this and that, but you're not giving the specifics that are.
The significance of this, as well as several other items, are the fact that the medical committee is meeting and they are bringing forward recommendations to the full board to take action on. But while the medical committee is doing that, they are not sharing the background information with the full board.
At this juncture, Peggy, allow me to interject some background information here. So there's two separate issues in play at this very moment. One issue has to do with adoption of some proposed bylaws language. That's one issue. That item has merit or not, all on its own. A second issue, Peggy, that you have introduced has to do with the statutory requirements of a subcommittee maintaining minutes of their deliberations. And you have in prior communications, multiple prior communications with me, cited 74-203 subsection 5 and 202 subsection 5 and 74-203. Now, that's a completely separate topic. I will be happy, if it is the board's pleasure, to go into the tall weeds of whether a subcommittee should maintain minutes. But bear in mind, that is a separate issue from whether we should adopt the bylaws changes. Now, if we want to have this conversation, I'm happy to have it. As it turns out, I've spent some time researching this topic, doing my own reading, and I have conferred with 3 lawyers and 1 city mayor. And there is a consensus, and there is actual clarity on this issue. But I'm not going to waste the board's time going through my research on whether a subcommittee should maintain minutes or, for that matter, follow any of the OML statutes. Let me hear from the board. If you want me to go there, I'll be happy to. Yes?
Mr. Chairman, if I could, during the second reading of this,
Mhm.
I was not able to be here. I was in the air going to Minneapolis and then back here to Spokane at the time of the meeting. So I had some questions when I received this packet
Mhm.
and went through, and on page 26 and 27, which is tab number 3,
Right.
I see just highlighted in red here. And so as I was reading it, I assumed that that was the only change to
Well,
the
there's-
bylaws.
Right. Actually, well, no, the bylaws as they were
As
adopted
they were adopted
back in December a year or so ago. Yeah.
January of 25.
Right.
Because I researched that as well. So that was my impression, that only this part in red was what was different. To me, that's standard practice. When you are modifying a bylaw, you will highlight in red, as was done here. And so I requested the actual bylaws so I could review it, and that would have been in February of 2025 when that was approved. I've got that as well. But anyway, as I compared, I saw that, no, that's not the only change.
Oh, no. What's changed here, I got what you're saying.
Yeah. And that's
This,
why I
no.
requested
The
this.
reason this is red is this is a change from what draft 1.
Okay,
So this red is draft 2
okay.
when you were in the airplane.
So that.
This, in fact, all of this, I'm not saying that all of this is the same thing as that.
Yeah, what I'm saying is that caused me confusion. I wanted clarification.
Yeah, no. There are, the wording, actually, the content is the same. In other words, if you were to read this and pick out, if you will, the germane elements of this language, you'll find mapping of that to this. The only thing that's different is the Nuremberg. Now, the only thing different from this version 1 is Peggy had some issue with Nuremberg Code, and I actually appreciate her concern. We took that out and we replaced it with different language. That is not to say that all of this is identical word for word with all of this. We know that this is a different.
So based on that,
And you saw this.
I would agree with Peggy, though, that there are substantial changes to the original bylaw.
Such as.
Well, that's why I requested that it be written in black, the original medical director, section 12 of our bylaw is in black. The changes as recorded here at the proposed modification of the bylaw, you can see, and everybody, hopefully you got a copy of that. It's in that section there.
You're talking about this, Glenn?
It's the handout,
Mhm.
correct. For reference. Okay, so you see there in the introduction, the primary purpose of the medical director is to provide, and it was crossed out, consultation to staff professionals and to assist was part of the original. And then it was added here, medical expertise oversight to the health district and lead the organization in the development, implementation, and evaluation of medical, and then added, and related programs consistent with mission, and then it's crossed out practice delivery, or, and then the original said the Panhandle Health District, and was added the directives of the Board of Health, which pretty
Okay.
much I'm fine with that.
Okay.
But it is a
It's
considerable
okay.
change.
So let me give you background there.
Yeah.
And now this is going to have overlap with Peggy's apprehension, and here it is. When this was created, a year and a half, almost 2 years ago, this was long before, this was back in the era when Duke was the medical director. This was long before we had the subcommittee.
We have,
This was long before we had gone through the exercise of imagining how we were going to reinvent the clinic, the medical clinics. So, as a prelude to now move up, I had in mind updating this language of a year and a half, 2 years ago, with now our modern conceptualization of the clinic, basically. And I gave our medical director a homework assignment. This was not a medical subcommittee project. I literally said, Greg, can you take the bylaws as they are and update them so that it reflects our modern conceptualization of the clinic? He said, sure. He then submitted it. There was not a meeting of the subcommittee to ponder Greg's language. I looked at it. I thought it was pretty reasonable. Joel just even confessed that he had not even read it, but read it when he was in the meeting when we had the first reading. And evidently he didn't have a problem with it. Then we got stuck with the Nuremberg Code thing. So we said, okay, we'll go back. But if there's language in here, we've had this language to look at for 3 months. You just got finished saying, yes, 3 months we've had this language.
but I, as a committee board member, have not seen the compare and contrast until this point.
Well, Glenn, to be fair, it was in the packet we all got emailed even when you were flying.
Okay, well.
So that, and it was in the
and
consent
again,
agenda
to
stuff.
me,
And Chairman,
It needs to be highlighted
Hmm.
to compare and contrast, so.
In this
then we
packet.
As the board and take it
Okay.
into consideration, discussion, and then action to approve it
Was
or
this-
not approve it.
no, and
Was this
Quick
part of the
question.
package?
no, this is a new document that Jessica created at the request of
This
board
one?
member Bailey because he wanted a clear representation of changes
How did
from
she
the
create
original.
that?
I had not seen this.
But wasn't this originally back with us when we read our new? So Jessica, how was this done then?
I requested this yesterday
Okay.
because I was confused when I saw this and thought, well, that's the total change to what is pre-existed.
Okay.
But when I received
Well, since we're
the rest of
for
it,
sure.
I said, well, wait a minute. That is not just a minor one paragraph change.
Fair
Well,
enough.
it's this is a one paragraph change from
But
the
there-
original
but there
pen
are
out
3,
version.
4, 5, 6, 7 bullets.
Glenn, that's non-arguable. I think you're right.
I think you're right too.
In the context of that is, since we're here, it
So
takes a
I-
lot
I
to get
just
us all
wanted
here.
Clarification.
Is there any issues or any points that you would like to discuss of
Oh,
those
yeah.
bullets?
Yeah, because,
Well, this is your moment to discuss
because
it.
these are significant, and most of them I agree with.
Well, which are the ones you don't agree with? So that when
Okay.
we come back next month, we'll
Sure.
Yeah.
incorporate your
That's why
disagreements.
I was going through this.
Well, would you highlight which one, then we can think about that then?
Okay, so the medical director would be evaluate, as it says here, medical expertise and oversight to the health district and lead the organization in the development, implementation, and evaluation of medical and related programs consistent with the mission of the Panhandle Health District. Okay. My understanding is the Panhandle Health District is directed by a director. That the medical director would be subservient to the director of the Panhandle Health District. Am I correct in that?
Yes and no, because in conversations that I've had with Eric and actually Tim Bertling, I think appropriately identified your issue in our very first meeting on this. And Tim made the observation. He said, well, look, this sounds like you're defining a job description, not bylaws. And in fact, Tim is correct.
Yeah.
And I think you're making
The
the same thing. All right. So the purpose of these bylaws is not so much to create a job description, but in fact, a reorganization of an org chart rearrangement. In other words, the proposal would be that in fact, the medical director does have authority over the domain of clinical services, and that there would be a bifurcation of responsibilities. And so you have captured, in fact, the very essence of what we're trying to achieve. So thank you for that.
But I wanted to say that had not been made clear to me as a board member,
Fair enough.
and I don't know if
Well, and
the
thank,
other board members.
and thank you for bringing it up, but
Well, Glenn,
but that
is it clear now, since we're discussing it?
Yes.
And if you have any additional follow-up, that would be great.
But the issue before us is, this is the third reading. After the third reading, normally we would take a vote to approve what is here.
Okay,
Sure.
and so,
I would be doing that, and the other board members would be doing that without a clear understanding of the intent of this change.
I got it. Are there other items that you want to discuss? Okay, keep going.
Let's go.
We could go on, the minimum qualifications, that's clear. The medical director must be licensed to practice the state of Iowa. The responsibilities paragraph here, serve as medical serve as the medical expert and consultant for clinical staff, epidemiologists, and medically related programs. So that's a huge addition to the
Well, that again,
previous
I,
way things.
and that
business was
is, and
conducted.
that's sort of the conceptualization of, if you will, the bifurcation of the responsibilities between the medical director who will take ownership of all clinically related programs.
So one thing, Glenn, my understanding is from previously is that there was no one fulfilling that role because the director was not a medically trained person in recent history. And so there was no one,
And that's an excellent point.
yeah, so there was basically an absence of that role. There was a physician that was technically a supervising physician role, but they were not on site and they were rarely involved from my understanding. And that might be, I can update my understanding, but so the idea is it's basically infilling a gap because the organization is so broad with such different areas of responsibility and areas of expertise that we were saying, hey, if we're actually going to lead in the medical side of public health, we need to have a doctor that's able to fulfill that role currently. Eric's mentioned before, he's an expert in environmental medicine stuff, not an expert in medicine. So, you know.
Well, in fairness, there's a lot of fields that the health district has that I'm not an expert in.
Totally.
But administratively, my role isn't to be an expert in everything.
Mhm.
It's to work with people that are experts and to take that information out to serve the community.
Mhm.
Larry Belmont, who was the district director for over 30 years, was not a doctor.
Mhm.
So
I agree. Yeah.
the work can be effectively done without having an MD behind your name.
And, but we need to have clean lines of authority though.
Yeah, and that's part of what
That's,
this is.
that's what we're
trying
trying
to
to
achieve.
establish is a clean line of authority so that there's no ambiguity as to who's calling the shots.
So
But at the same time, that was not the stated purpose, as I understood it, as a board member, for the formation of the subcommittee, a great position.
No, this,
Do it,
right.
but your conversations
Mhm.
we were not made privy to those.
So are you saying this updated document, the first time I saw it was when Thomas presented it at the first reading.
Okay.
So that was not a medical
And to-
subcommittee
and to
kind of.
clarify, my understanding was it was presented as minor changes,
Okay.
correct?
I don't remember the details of that, but
Well,
it is
In
videoed.
terms of
It is videoed, so we
responsibility,
can
it
go look
actually
at
is
It's
minor.
minor.
It really is.
However, my understanding was we had hired Dr. Pennick as a temporary to come in to evaluate and to give us his thoughts and which I'm all for that. And
Mhm.
he's come up with a lot of good things
Mhm.
for our clinical services. But this, in my opinion, is saying, okay, we have one director now for all of the other activities of the Panhandle Health District, and we have one director of clinical services,
Correct.
okay?
You just said it.
But that was not my understanding of what was happening.
So
Dr. Pennick is an excellent physician.
are you suggesting that we not have,
No,
him
I'm
in
not,
charge?
I'm not saying that.
well, then what would be your alternative?
What I'm saying is, it needs to be brought before the board, that is the intent
So I think
of this
my point,
modification of the bylaws.
Right. so my understanding, if to reflect, is that you want to have the opportunity for the board to properly discuss and analyze this.
Because we've got to do that when we discuss and decide and take an action. And I'm not saying that I would vote against it, I'm just saying
Now's a
We
great
have-
time.
we haven't had the opportunity
Okay.
Mhm.
to come through and discuss all of these proposed changes.
Can we do it
What
now?
other proposed changes do you find that are
Well,
material?
Glenn, would we be able to move forward and do that?
We are moving down through those
Okay.
now.
Okay, go.
But
So we're with
what
you,
I'm saying is.
Glenn, we're
this
with
is-
you that we need to go through
This
that.
is the third reading.
Okay.
we have not had time to independently research the things that are being proposed here,
Okay.
okay? Then to come to a proper conclusion, and we have not had an attorney go through and compare this with Idaho code and federal regulations either. Is
So
what I'm saying.
Would you like to, so then are you proposing a fourth reading, but it would still not serve because if we come to the fourth one, then we still haven't talked about it. So I think instead of talking about it,
Research it, and the other board
That's fine.
members would have an opportunity to get clarification.
I-
We would have an opportunity to consult with legal advice. because
Glenn?
None of us are attorneys,
Glenn,
and that, so.
Glenn?
yes, Dr. Noel.
this is the time for us to all talk.
Good.
So that's
So let's discuss it.
100% with you. Let's do it. So I would say start through your
So,
stuff.
we go under the responsibilities to serve as medical expert and consultant for clinical staff, epidemiologist, which wasn't on there before, medically related programs, that's not clarified.
Okay, then we should hit each one of those and discuss it. So then that can help lead any further research that anybody wants to do. But if it's just they haven't discussed it and we move on, then you still don't know what any context
Be
is.
educated on.
100%, no problem.
Okay, so are you okay with the medical director overseeing epidemiology?
We also have a hand up online, Chairman Fletcher,
I'm sorry?
a hand
Peggy-
online.
Peggy would work. Yeah.
Okay, go ahead, Peggy.
So I just wanted to update Glenn. Glenn,
Yes.
I appreciate you bringing up the legal review. I brought that up last month, and I believe neither you or Tim were at the last meeting. And the first meeting, when the proposed bylaws were discussed, at that time, I felt there were 3 board members that recommended legal review. But I was told by the board that was present last time that because there was not a first or a second, and it wasn't an action item, because I actually asked for it to be removed when it was on the agenda the second time, because legal review had not been done. So I just wanted you to be aware of that. And I don't know if Commissioner Bertling might want to weigh in, because I know originally he also recommended that the bylaws have legal review. And a lot of the questions that are coming up, like my questions about state statutes, my questions about minutes from the medical committee, questions I've had about the agenda, all of these could be answered if we had legal counsel available. Thank you.
I would agree with Peggy on that matter, about this, that it should go to legal counsel and have it reviewed.
Okay, thank you, Tim. I think that all of that, Peggy, good points. Tim, thank you. Would be probably after we actually discuss the issues anybody has, because we shouldn't kick it to legal, because that's how you spend up a big bill if you just kick stuff to legal and we don't actually even know what we're having questions about. And then once we've discussed it and say, okay, this is what we would like, then we could present it to a legal if that's needed, and then have them on what we actually discussed. But if we send it to them and we haven't actually discussed, we might actually then change our mind after we paid them to review it, and then have to send it back to them for another. So I think the most important thing, we got the clear point. Tim, you want to go legal? Peggy, you want to go legal? Glenn, you're interested in legal? Great. We should talk about it in specific detail so that we have specific notes so we can provide legal with those notes if we're going to present that. But if we don't do that, then it's going to be probably just a round robin of money spending, which is something that we really need to not do. So that's my thought, is we need to actually go through the items, get on the record everyone's individual concerns. That can be presented to legal. They can watch the video, the whole thing, and then they can give us an idea on if there's anything that might actually be objectionable. in a state code or statute type of thing. Does that sound fair enough to you guys or no?
Yeah, I think that's fair, as long as we go through this, discuss these issues, and agree that we would have a motion then to modify this or to approve this as here presented, but not to go into effect or become the actual bylaw until we have had it reviewed.
Right. Make sure we're not in any
and we have
violation.
Consultation
Mhm.
advising us whether we need to modify it
Yeah.
again. And then we could come back and we would have the time to do more research.
Sure.
Because I like what I see here
Hmm.
in a lot of ways.
Yeah.
But at the same time, I don't know if it is in compliance
Hmm.
with Idaho code, with federal statutes, et cetera. But I like what I'm seeing. So.
Fair
as I
enough.
was saying, the first bullet point, staff epidemiologists, medically related programs. I would like some clarification on what those programs are that are referred to here. Okay, the next bullet point, which is new, availability to answer clinical questions. So we're proposing a full-time employee as the medical director. Am I correct in that?
And that was what was approved on the budget.
It doesn't.
You-
It doesn't necessarily have to be full
The
time.
budget subcommittee
No,
approved that.
he's just confirming. Is that what was actually just to verify what was approved?
Yeah, that's
So-
what was approved. He's no longer temporary labor.
Okay, so because that was.
Well, Chairman, the budget.
That
hasn't
is what
been
is meant.
approved.
Now, actually,
I understood it was going to be a temporary.
and
thing to
it
see
was
how it
until we
goes.
passed the budget.
Chairman, the budget hasn't passed.
I understand. Actually, Eric is correct.
It had-
We're almost there. This whole program could unravel Wednesday of next week if the commissioners don't want it.
And I can understand. And that's-
So,
that's why I wanted to get some clarification.
Okay.
We probably need to do it today as much as possible.
All right.
Okay. Establish, the third bullet point, establish, maintain medical policies, procedures, and standing orders. That's pretty broad.
So that in a
it's what a
In a
medical
normal-
director does.
Is it-
in a normal medical clinic.
Is
Yeah.
it, is it something that we
Mhm.
can just grab and modify somewhat? Do we have access to that?
So
Now, let
just
me
for
give a little
example,
bit of background here.
yeah.
When these were generated a year and a half ago, I wrote them. There was no subcommittee. I wrote them. And I have a confession to make. I plagiarized the job description of the medical director from District 2, was it? Tippett. Who's Dr. Tippett?
I think
What-
District 3 had a.
District 3,
medical-
okay. I plagiarized the job description of the medical director from Health District 3.
Which is, I can. agree
So,
with that. Okay.
it's not like this was just full
So you did
cloth
that a whole
invention.
lot. Okay.
I mean, I modified it a little bit, and then I brought it to the board, and the human being who had the most weigh in at that point was Dr. Johnson, who said, I don't want to be responsible for all that. So we whittled it back to if you will, a smaller core set of obligations or responsibilities of the medical director. And that's what you're looking at here. So, you can say this is too broad. Well, it's too broad for District 3 also. I mean, this is kind of what medical directors do.
Chairman, I think a key element though here is the creation of a second director. That's certainly not a construct that's either clearly defined in statute, nor is it something that any of the other health districts are
Okay,
doing.
that's a legitimate point you're making, and that was Glenn's original point. But we're down the road now. I mean, sooner or later, the board will have to address whether it wants to in a sense, grapple with a reorganization of the chart.
And I think that though, it should also be noted that if it isn't allowed per the statute, if the construct is not, then is this all for naught?
It is not prohibited by statute. I mean, you can assign roles and responsibilities to a medical director, and the statutes are not. In fact, the statutes barely even comment. In fact, the word medical director is not even in the statute.
No, and
Truth be known.
I think that the reason for that is when you look at the construct of a health district, you have the board that provides direction, and then you have a director, and then all employees fall below the director's position. And so you have position descriptions that describe the roles, and District 3 has a medical director, and that position description describes that role, but that medical director does not report to the board. So that's a significant difference.
Okay, and I hear you, and that actually was Tim Bertland's original observation. To his credit, he saw the essence of what was going on. You hear that, Tim?
Thumbs up.
Thumbs up.
Yeah, I hear it.
I mean, that was the moment to talk about it. I mean, is this, if you want to say we shouldn't do this, then say we shouldn't do this. That's fine. Or if you think it makes sense that we have clean lines of demarcation of responsibility, then vote differently. There's no hidden agenda here. Tim understood it immediately. I would add, if you want me to go into more detail, we're going to have to go into executive session, by the way.
If I can make a comment here. Eric, would you want to be in the position of establishing medical policies?
No, but I would love to have a qualified individual that could build those out.
Exactly.
I depend regularly. My
Exactly. See, I mean, in other words, the term, I think a lot of the confusion here is people not understanding what the term medical director means. I've been medical director of several different localities, and these are definitive terms of what medical directors do. I mean, so in other words, they're standing with their license, with their experience, with their knowledge to say, I'm establishing this this direction or this policy, and it's actually protective to the health district because a doctor is setting it, not a board of non-physicians or not a director who's not a physician. It's actually very protective. I'm getting the notion that somehow this is seen as unprotective, but it's actually very protective.
No, it's not that. I'm looking at this from the organization being able to function in a meaningful manner. If you have two directors, and I see that another item that's pretty notable is you've removed the remedy that if there is conflict between the director and medical director, that it no longer goes before the board. So if that item is removed, then it would lead me to believe that there's no resolution between a medical director and a director, but rather the medical director
Where's
simply
that?
move forward.
Right here at the end. The last one is all lined out.
So, I mean, see, that's why we want to bring, I mean, let's go through each one individually because see, that
Okay,
point
well,
is
then
completely
let's-
separate from who's establishing and maintaining medical policies. I mean, that's a physician that should do that. I mean,
But that's,
I mean, so I mean, in other words, policies, procedures, and standing orders. I mean, you don't want to take responsibility as a
No,
non-physician for standing orders.
When Jenna Dow was here, she created clinical policies and procedures because that was her expertise. Jason does the same thing in environmental services.
Right.
Epi does similar things. So we don't have 7 different directors here at the organization, one for each major program. We have one who relies upon the expertise of the many. And that's the construct that's built within the statute. And I'm unclear why we would deviate from that, or what the board or the medical subcommittee is hoping to accomplish.
Well, I'm glad you mentioned that last point, Eric, because indeed it had, and thanks to Glenn, it escaped my attention that this adjudication provision was removed. Absolutely not. That adjudication provision must be reinserted. Must be. For precisely the reason you articulated. So kudos. So this is now finally a constructive conversation, by the
It
way.
was good.
Tim has his
we're
hand
making
up, Chairman
headway.
Fletcher.
And that's reassuring because my understanding of the hierarchy of the.
I hate to kick the can down the road, but really, this whole discussion is great, but we need to get the budget done to see if this position is going to be around. And then discuss it further. We're discussing something that is still not in concrete.
So question is,
Tim is correct.
just a clarification point is when the budget next Wednesday, when the budget's getting decided upon, they're deciding on whether or not the commissioners are deciding whether or not they're going to fund basically the budget we requested, right? So if they choose not to fund the budget that we requested,
I'd say it would be
Then-
back to the
then-
drawing board
then
on the
for all
budget.
prac-
for sure.
For all practical purposes, there will be no clinic.
Well, no, I don't think so. Because it's not always a black and white. They might be like, we'll do this, but not
Okay, we'll
100K, or we'll do this, or,
Be able to get this
Yeah.
resolved within that time frame.
right. And so then,
You mean between now and next Wednesday?
Yeah, between now and next Wednesday, we may have to have an emergency meeting to do it.
All right, well, we've identified one thing for sure, and that is reinsertion of
Mhm.
adjudication.
Yeah, the
What
last
other
bullet
things,
point.
all right, keep going,
Okay.
we're on a
this
roll.
is good.
Okay, so.
And Chairman, just one other comment as far as Glenn's comment on timelines is the budget that the commissioners are voting on is the fiscal year 27, which takes effect July 1.
Mhm.
So any funding that's allocated for a medical director position or any other position really does not become available until July 1. So this doesn't have to be resolved between now and Wednesday. There is some time to have further conversation.
Okay.
Valid point.
Okay, so the fourth, one, two, three, four, fifth bullet point here is establish and maintain medical policies, procedures, and standing orders. That's what existed is black, and I can agree with that, no problem, no issue. The next one, there was a lot of red line here, medical director would review, that's red line, and it says provide risk benefit analysis for all this.
PhD, no, it'd be
Informed consent.
PhD
and-
procedures,
and I
yeah.
like the informed consent portion here.
Mhm.
There was some part of a red line, then it says the ethical and legal process whereby the healthcare professional educates the patient on the risks, benefits, and alternatives of procedure, enabling to make a voluntary, informed decision without coercion.
You're okay with that?
You know, big thumbs up.
Okay.
But now,
Next.
okay, and the next, yes.
Mr. Chairman, if I may,
Sure.
can we go back to bullet 3, which also applies to bullet 5, the one that Glenn just read? When they say establish and maintain medical policies, procedures, and standing orders, should that be procedures to medically related programs? Or is that intended to be procedures related to the district as a whole? The same applies to the bullet that Glenn just read.
Clarification.
Clarification
Oh,
on the
that's a good
type
question.
of procedures.
No, that's a good question.
The way I read that is the adjective medical is what takes the place or follows in all three, so that we could reword it to stay establish and maintain medical policies, medical procedures, and medical standing orders, if that reads more clearly.
I think it should be very clear.
Okay, fine. Thank you.
Like that, change the grade. Okay. So.
Okay.
The last bullet, it's in black on page 4, is consultation with, and then it goes on to the next page. Health district leadership team on clinical operations. So is that our medical subcommittee that we're in reference there? District
No.
leadership team on clinical operations. In other words, that's not clear to me.
That's,
Says consult,
Clinical operations would be all the operations of clinical services in the clinic.
So that would fall underneath the medical director.
That's actually the most obvious of all of them. Yeah,
Or doctors, nurses.
yes.
Okay.
so it's a consultation with district leadership team
Yeah.
in clinical
That's not
operations.
clear to me. Who is the district leadership team?
It would be
On clinical operations.
all of the
how about
different
just clinic
section heads.
staff?
Yeah, clinical staff. yeah.
Replace the word staff for team.
Okay.
Would that work, Glenn?
Yeah, that makes more sense to me.
Okay, make it,
Because when we say leadership team, to me that infers.
I got it. We're talking about staff here.
Okay.
Got it. We're on a roll.
Next bullet point would be research current medical publications to ensure high quality clinical services service offerings, and budgeting. And that falls under Christine, I would think.
Well, again, the way I interpreted that is that there's a lot of different ways for how you can correspond with current medical recommendations, and there's several different layers of costs involved, and so the purpose would be to fulfill those requirements with the least expensive or appropriately expense being applied. Not that it would be taking over budgeting, but in other words, making recommendations per se. So that could perhaps be worded more clearly, right?
To stay within the approved budget?
Well, one option is in a facility, sometimes you can buy sponges or gauze that are 2 cents per sponge, or you can buy ones that are 10 cents per sponge. And if they're equivalent clinically, then you might make a decision, hey, we're actually going to buy that one, or that kind of thing. So, I mean, it can be that practical.
So there's macroscopic budgeting versus microscopic
But
budgeting.
that would be coordinated with the financial specialist for the business.
My recommendation, if I may,
Yeah.
would be to state and related budgeting or and clinic budgeting.
Mhm.
And that also applies to the line above where it says and budgeting. Again, I
Okay,
would.
so give me the exact language, or give Jessica the exact language.
Okay, and clinic budgeting.
So you would just add the term clinic.
So again, you want to have that
Okay,
adjective pushed through to each one to just for absolute clarity. So
Yes,
clinical operations, clinical strategic planning, and clinical budget.
please.
That's good.
So can I just raise a point, Mr. Chairman? I'm not sure where the red line items come from in the handout. It's clearly a lot different than what the completed document was under medical director bylaws changes. So I don't know where these edits come from, honestly. There's nothing about clinical budgeting in,
oh, I see what you're saying. In
The
other words, the
medical director
version you
by-
created just doesn't even have budgeting in there.
that is correct.
Oh, interesting. Well, then, Glenn, do you,
That needs to be
have you
sorted
gone
out.
through
No,
Greg's version at all?
oh yeah, I've got it
And,
right
and,
here.
and what are the problems with it?
Well, that's why I had this highlighted to show the changes, the difference between what was the original in
Right.
black.
So
Yeah,
budgeting
but
was,
Greg's point is good because
Supposedly, what is in red is supposed to be what was changed from the original.
well, so let me just pick up on that example.
Uh-huh.
In the page 26 version, it says, research current medical publications to
Which
ensure.
bullet point is that?
It's 1, 2, 3, 4, 5, 6. Research current medical publications to ensure high-quality clinical service offerings and accurate media representation. It says nothing about budgeting. So then you go to the line out, that's an addition. It says research current medical publications to ensure high-quality clinical service offerings and budgeting.
I have no idea where the end budgeting came from.
And Chairman, I think what I would say is
So what you did when you revised it was just kill that word.
well, no,
Well,
I
it was never in it.
I think what I'm seeing is in an effort to provide this, as we worked through this yesterday, there may be some typos in this, but we wanted to be able to get the information
Yeah.
so that,
So I could see it and we could present it to the.
This is a newly generated document, not
Correct.
historical document.
correct.
And we don't know that
Okay,
it's.
but this is still a useful exercise because if
Yeah.
all we do is kick the can down the road,
We don't
we're going to
want-
be right back here next time.
We don't want-
So please keep going.
Keep going, keep going.
Okay, so Dr. Pennant makes some good points. We need to sort this and make sure that it's still agreeable.
Because you see, he's already cleaned it up a lot.
Yeah.
For instance, budgeting is not in his version.
Definitely. And everything that we're discussing helps me to understand it better.
So in other words, Eric, the word "and budgeting" was something that,
That was.
Well, looking at the comparison,
And
it
it was,
looks like
and it
that
was
was,
added twice, let me add. It was
Yeah.
added twice.
So
So
it may
whoever
have been a
added
mistake.
it twice.
it's a correct addition in one of the prior bullet points, but it looks incorrect in the one regarding
So which
research.
is the one
Okay,
that's
all right.
correct, you know?
So, well, I mean,
The one
Yeah.
prior.
yeah,
Okay, so the first
Let me
one
see
is
a
correct.
copy of this without red on it.
Well, but that helps me to distinguish what was.
I think there's a signal to noise ratio problem.
there is-
Mr. Chairman, on page 26, the consultation with Health District Leadership Team on Clinical Operations, Strategic Planning, and Budgeting. So that is correctly reported on this one. I think it was just inadvertently added to the research current medical publications line. That's what it looks like.
Okay.
Okay, so we
All
cross out that one at the end of the research current medical.
right, right.
That helps.
And then add an accurate media representation instead, because that's what he put, or kind of put in his version, was accurate media representation.
Okay, so then we need to do what Christine was requesting, where we add those adjectives when necessary, to kind of do that.
Yeah,
Clinical,
And then,
okay. Well, I still like the idea of highlighting in red the proposed changes so that I can understand. what
fair
these-
enough.
All right, well, you're on a roll.
Okay. So next line, support, contribute quality improvement initiatives, no change. Review and make recommendations for all medical error incidents, no change. The next one is an addition, quality control oversight, make improvement recommendations for all medical error incidents. I like that. I have no issue with that.
Okay,
Um,
so that's a keeper.
Next one said may provide, but it strikes the may and says provide consultation to other partner organizations as determined through formal agreements. I'm fine with that because I know we do partner with other organizations. Next line is an addition. I thought it's a new bullet point, it says, but it's all in black there. Audit provider charts as needed, approach accordingly to ensure best practice care is provided. Thumbs up. The next one looks like an addition would be provide regular training to clinical providers on a consulted basis. Sounds like a good idea. Next one, act as supervising physician for physicians, nurse practitioners, physician assistants, and other healthcare personnel as needed. I like that. Regularly, the next bullet point, regularly audit provider charts and coach accordingly to ensure best practices are followed. That's assuming that this position, the person in this position is doing best practices. But that, I guess, could be reviewed by our medical subcommittee as well. Yes. Oh, well, I'm not.
That appears to be a duplicate.
Oh.
Go up 3 bullet points. It addresses audited provider charts as well.
Yeah, it was
Oh, yeah,
on
it
the
is.
27, when it's not duplicated.
Right,
It's duplicated on the one. for
yeah, it is a
today
duplication.
On page 5.
You liked it the
Good
first
point.
time.
Yeah, thumbs up.
Okay.
Okay, the acting supervisor position, personnel unit, regularly audit, okay, that's all good. And the next one would be in conjunction with executive administrator, which would be
Eric.
Ensure all medical programs are compliant with applicable
Idaho
Idaho
statute.
statutes and regulations. Good.
The lawyer should be happy with that.
Yeah,
And it also should make Tim, I suppose, happy because it means that Greg can't go rogue. He has to work in conjunction with Eric. It's not that he is an independent actor.
okay, but in my concept of operations, he would be a step down from the director of the Panhandle Health District, because you gotta have a chain of command. You
Well,
gotta
how about
have
this?
one
Okay,
individual
all right.
is ultimately responsible.
How about this? How about in collaboration with or at the approval of the executive administrator? Would you be happy with that language?
Yeah, because that indicates he would be a step down.
I got it. Okay, so Eric has to give his blessings.
Correct.
Tim, are you happy with that language?
Yes.
Okay, well, is there anyone who does not like my language?
I
Oh,
like that.
Commissioner Korn,
I have just a point of clarification.
yes.
The org chart for Panhandle Health this year. Is Eric over the board or is the board over Eric?
He's our secretary.
Oh, it has nothing to do with bylaws, that's statute. In statute, the board is over Eric,
Okay.
without a question.
Ultimately, the board is in control of Panhandle Health.
Absolutely.
Correct. Now, the board, if it so chooses, can capitulate, which is sort of what we're doing right now. But I like the gist of where you're going. This board tells him what to do, which is what we're going to loop back to. Because appropriately, Eric pointed out that the adjudication measure was not on the final version, on the pinout version.
That is correct.
I'm going to insist that adjudication provision be reinserted. We have to. Because if there's a difference of opinion between these two gentlemen, they don't duke it out in a mixed martial arts arena. They bring it here and we figure it out. So I think that's appropriate.
We've
But
actually talked about alternative forms of combat.
The sumo suits. We can-
Okay, so
budget.
Tim, you're okay. So basically the language would be not in conjunction with, but at the agreement with, what word did I use before? With the approval.
And then in here explicitly for the thing would be, because it doesn't say specifically, it says if medical director and staff have an issue. Not if the medical
Well, and we'll
director
also
and
say, but
the
staff includes
Panhandle
Eric,
director. So, yeah, I guess generally,
the director and or staff.
yes. So we just kind of clarify that.
And we can
And then it can be
insert.
brought, if either of them have a problem with the other, it can be brought and the board can just.
I mean, I honestly think Tim is onto something here.
Yeah,
The more I think about it, he's correct. There still has to be unambiguity
yeah.
of the chain of command. That's obligatory. The military has that. I mean, any organization that's going to be functional, there has to be a very well-defined line of authority. Now, that's not to say that a 3-star general doesn't disagree with a 4-star, and I guess they have their ways of figuring it out. Yeah, the martial arts thing. But nevertheless, an effective organization has to have clarity of authority. So thank you, Tim, for bringing that up.
Mr. Chairman,
Yes.
just a point. In statute, it is the district director, not executive administrator. So I would suggest that amendment in the language to
What language do you want?
executive director or district director.
District director.
Yes.
Okay, so with the approval of the district director. Thank you. Approval of district director. Okay, all right.
And Chairman, one minor comment, this specifies Idaho statutes and regulations. I would expect that the medical, well, much of what we do is also subject to federal regulations based on the contractor to the grant. So it should probably include federal and state.
I would say that'd be slightly different, I think, because that would be specific to wanting to keep the grant. It's not necessarily a legal requirement on us. It's more of a MOU
Grant
agreement.
Specific.
It's grant specific. That wouldn't be necessarily like a bylaws level thing.
As, you
More-
could say as applicable.
Right, because we want to have local control, not in,
Because if there's a
Specific
general
to our
federal
needs.
statute that say Idaho chooses to not go along with, like the states have in their own ways have chosen to do something different than what the feds say, then we need to be able to follow the Idaho ruling and not have to follow the feds ruling. And
No, I wholly agree. I'm not proposing that we be
Capitulate to
subservient.
the
I
feds?
am not saying that. I'm simply saying that in some cases, there are pervasive rules that regardless of what a state wants to do, you can be subject to them. So
Well, that would be-
If it's in the language of the grant.
So then you'd either choose to let the grant go or follow the grant requirements, right? But that's not necessarily in the bylaws because we don't want to be bound to grant requirements in the bylaws because the grant requirements come and go, grants come and go.
Well,
It has to be decided on an individual basis.
And there was a fifth, well, and there's actually, there was an important Fifth Federal Circuit decision that was made summer before last that delineated or made now clear that the FDA and the CDC have an advisory role, not a statutory legal role. Advisory. So if Health District 1 and way up in the northern aspects of Idaho seek to not take that advice, that's not illegal. It may be impertinent or a mistake, but it's not illegal. So I like what Joel said, make it grant specific in compliance with grant specific obligations.
I think if you just struck Idaho, then you would have applicable statutes and regulations, and then that would cover both.
Oh, I like that. Oh, is there anyone who doesn't like what Eric just said?
I'll talk to my lawyer.
Mr.
I'm just
Chairman,
kidding. That'd be funny.
No, I think that's, yes, ma'am.
excuse me, could you summarize that bullet again on what is being amended to?
Okay, here we go. Because there are actually several people who have contributed to this. I've tried to keep track. Thank you. So, with the approval of the district director, the medical director will ensure that all medical programs are compliant with applicable statutes and regulations. And I would add there, applicable statutes, regulations, and grant-specific requirements. That's the language I would choose. You want to make a modification?
So when you reference statutes, are you meaning Idaho statutes?
They might be, or they may be federal. That was kind of Eric's contribution here.
Okay, because if federal is stronger, federal takes precedence.
And we all, certainly the feds want you to believe that.
Well, the thing is that it not necessarily. So many states, such as our neighbor Washington, have chosen to allow for medical marijuana, and it's still federally legal. So they've said they're exerting state supremacy, and so that's a normal thing that's happening in states all over the country. And so if us being established by Idaho statute, we are under Idaho law statute, and so if we choose to go once against something that Idaho has chosen, even if it's against the federal statute, we are now out of compliance with Idaho statute, which is our entire authority comes from Idaho statute, not the federal. So that's where it's critical that we don't lock ourselves into a federal via bylaws.
I would agree that we
Yeah, it's
don't
critical.
add the federal aspect of it.
Yeah, we need to make sure we exclude requirement of federal such that it's only Idaho and or grant specific, because I think we can choose federal if it doesn't violate Idaho, but if it violates Idaho, we have to go with Idaho because that's who is our actual authority in the statute comes from.
So do we
And
need
then
that in
this-
our bylaws,
What?
that policy?
Well, that's the Idaho statute. Well, I mean, yeah, it could be probably, yes. I think it should be.
Yeah, we should have that spelled out in our bylaws.
That'd be a
I
different
agree.
section though.
I mean, it means that we're obeying the law.
Mhm.
It's saying we're pledging to obey the law. I think it
Well-
should be in the bylaws.
Well, oh, go ahead.
This may be what Eric was saying. What I would like to state is then we need to be judicious in the grants that we take. Because if,
Amen.
Point
Well-
taken.
Amen.
100%.
Well, or eliminate the last part of, because we're talking about insuring. I'm not sure we always want to ensure that we're complying with every federal
Right.
grant, because we may choose to go down the pathway of being freed from that particular grant per se.
then we shouldn't take the grant.
Right.
Exactly.
I couldn't
Exactly.
agree with you more.
Exactly.
And that-
So
and
so
what
they're
you-
both saying kind of the same thing. I mean, I'm not sure that we should always.
And this
lock
is not
ourselves
singular
into-
to Panhandle Health.
No, but
States and counties encounter this all the time, the famous ARPA money.
Yeah.
My goodness, there are strings attached. And so counties, or states, I mean, Governor Little is taking gobs of money for Medicaid. You can bet there are strings. Should he take that money?
well, the
It's above my
subgrants,
pay grade.
excuse me. The subgrants are very specific in the subgrant language as to what the grantee must adhere to.
Exactly.
Absolutely.
But that's why I'm not sure that we should put into the bylaws that we're always going to follow every grant.
I agree.
In other words, I think we
Well,
don't need
or
to add
don't
that.
accept that grant.
We don't need to, yeah, well, but we don't need to put ourselves underneath the wording of a grant. I mean, in other words, just Idaho.
Right.
statute.
Oh, I see what
So,
you're saying.
Then if I can go back to our
I mean,
meeting
leave it
with,
unsaid.
Yes.
yeah, leave it unsaid.
Okay.
Being
Was
with
that your point?
Idaho Risk Management specifically said, as long as what we're doing is not against specific Idaho statute, they specifically said we have broad statutory authority to make policy, not to follow policy, but to make policy. And so because of that, we don't have to follow other policy as long as it's not against a specific statute. As long as we're not violating a specific statute, and they will back us up because we have the statutory authority to do that very thing. And so that was something they made very clear to us, that it explicitly that we could do that. As long as we were doing their compliance, which is more of just good business compliance stuff, and violating the specific statute, then we can make a policy and they'll back us up.
But that
So it's kinda-
needs to be spelled out to those who are applying for the grants.
Mm-hmm.
They need to understand that concept.
Totally.
So that concept should be in our bylaws.
Well, now I'm hearing two signals here. Some people are saying, leave that grant, shall we say, small print unstated, and you're saying we need to state it. Which way are we going to go?
I'm saying that we need those who are applying, those who are doing this at the lower level have guidance. Where else do they get that guidance? If it's not bylaws.
Okay.
But we can still adhere to a grant requirement without us putting it into the statutes. I mean, in other words,
Into the bylaws,
because we are in the bylaws, because if we
Okay, so how do we give instructions to those who are applying for those grants?
That's
Well,
a
you know
good
what?
question.
When
I'm
the
going to
grant-
assume
That's a good
that the
question.
combination of the district director and the medical director have enough common sense to know that they're going to read and I know Christine's going to be
Okay,
it's going to be over their head.
They know the position.
They know the position. I mean, Christine's going to be in on the conversation.
right,
So they would probably come before the board with the question.
right.
It works.
Right.
Exactly.
Right.
That's how I see it.
So that would
Are
be
you okay with that, Christine? Okay.
that
here
would
we
be
go.
one thing, Christine, too. And I don't know if that's been done before, but if there is a concern about an issue with a possible grant that would lock us into a certain thing, like we have that have put us into a cash negative position on one or more than one grant that we have, at least one grant, then we would then discuss that and say, is that something that we care enough about getting that we're willing to lock ourselves into that restriction? So that would so is there currently any dialogue? Like where does that dialogue happen? Is there an issue? Like, I know that there's grants from all the different sections.
So grants are, as they renew, they're always reviewed. And the terms and conditions are reviewed for any changes. If there is something that has changed, then if it's significant, it's discussed, it's brought to my attention, the program manager's attention, Eric's attention. We have a routing sheet where those things are called out. So most of them are routine, we renew annually, so no significant changes. It would only most likely be related to new grants outside of health and welfare that we would apply for, that we would need to scrutinize closer.
Thank you.
Most of the language, if it's federal money, it's pretty standard. Really no red flags in them.
Mr. Chairman, can I make a recommendation? I don't know whether you're considering talking about decision-making authority or not, but in the interest of time, it sounds like there's conceptual disagreements with the organizational chart. Can I recommend that maybe the board works out the organizational chart before the next meeting to save that discussion until then? Just a thought.
Well, I think in a way we have, if I may, if I'm reading the audience appropriately. I mean, it was launched by, well, it was really a launch by Tim Bertland 2 months ago. Glenn picked up on it, and they're on the same theme, if I may speak for you. You have to have a chain of command.
Absolutely.
I think the decision, and I actually agree with them. I agree with both of those prior commissioners. Well, one's a current commissioner and the other's a prior commissioner, and they have a, shall we say, an understanding of what chain of command means. And I respect that, and I happen to agree with them. So the truth of the matter is, Greg, you're working for him.
Well, I always have been. There's never been any.
But we're gonna reflect that in the bylaws.
Peggy has her hand up.
I'm sorry? Oh,
Peggy
yeah, go
has-
ahead.
Sorry about that. I was still on mute. and
We can hear you,
talking quite a
Peggy.
bit.
We can hear you.
Okay. Greg, thank you for bringing that up, but I do want to go on to that first bullet point under decision-making authority, because again, in line with the chain of command comments earlier, I think this particular bullet point really needs to strongly identify that chain of command. And, the decision-making authority over epidemiology, PIO, and nutritional services, I understand decision-making authority, again, under the chain of command for clinical services, but the public information officer serves the district as a whole. And I don't remember when the decision was made to hire a medical director. My recollection was it was for clinical services.
Okay, that's a valid point you're making, and actually,
May I
if we
answer-
continue,
May I speak to that?
you can in a way, because, thank you for bringing that up, Peggy. Glenn Bailey was marching down the document, and he would have gotten to your point in about a minute or two. But if you want to jump to PIO, that's fine. So the question is, in the chain of command, well, obviously, even if we said that the medical director was, shall we say, immediately above PIO, remember that the district director is above the medical director. So if there was if there's dispute or misunderstanding or ambiguity between those two gentlemen, then the resolution is still coming to the board. So in some sense, we've got nestled authorities here. In no way putting PIO under the medical director is going to, shall we say, undermine the district director's ultimate authority. It does not undermine it, because we've already said anything that the medical director does has to be at the approval of the district director. We've already acknowledged that.
However, the exception would be, there's plenty of public information officer work that is done throughout the district as a whole.
Well, Peggy, that would be a good question. I don't know if we've ever had that presented, like, of the PIO's position. Like, do we have a percentage by department on kind of approximately how much time or utilizations occurred in the last year or 2 or 3, 5?
Not,
I mean,
we don't have it readily available.
Ballpark, I mean, I think it's mostly, I don't know, does the environmental, do you guys do many PIOs like that would use a PIO?
Not regularly, but we
Both
do,
MPAs.
for instance, harmful algae bloom communications, those types of things, public health advisories.
Okay.
But,
I would say there's been an effort to push out
Thank
information
you.
generally for all programs,
Mm-hmm.
equally. I know that there's an interest to do additional marketing in clinical services.
I think that,
Okay, so
See,
Peggy,
but-
reflecting your interest here, why don't we say PIO as it pertains to medical issues? Would that satisfy you?
Yes.
Okay. So in other words, it's a subset of PIO. Okay. Greg, are you happy with that? I mean, well, you're not a board member. You can't speak.
I can't speak. Yeah.
Right. Well, I like it. Is there any other board members want to weigh in?
Well, I would think that the PIO would be interested in the knowledge that a physician may have concerning communication on topics, because even because physicians are used to communicating with the public on a daily basis, and they get immediate feedback on the reaction that patients have. Well, what does that mean? Well, does that mean this? Does that mean that? And with a lot of experience, a physician is going to know, well, let me head that off by wording it this way and wording it that way. And I think that a PIO would want the input, and it would be more protective for the PIO and the health district to have that input. I don't know why there's a big risk to at least get his input.
I think it goes back to the concept that we have a lot of people and a lot of programs here, and all of them have their own areas of expertise.
Mm-hmm.
And if messaging is going to occur or if questions are received, we're going to seek out the person to answer that. If they're medical questions,
Mm-hmm.
we will seek out the medical director's primary input.
quick question. It's somewhat
we'll have
pertinent
that
to this.
reflected in the bylaws.
Mhm.
Otherwise, you will be overseeing what the PIO says relating to, I don't know, some outbreak of hantavirus at some restaurant in town.
But see,
It
my,
depends on the question.
but see, my point is with that is that we're a health district, and medical directors are involved in health. I mean, so in other words,
Absolutely.
it's not like we have a plumbing service or something that has nothing to do with health, or a road service or a fencing service or whatever you want to come up with. I mean, in other words, almost every topic is going to involve health. So that's why I'm kind of confused by
Oh, I
trying to
see your
separate
point.
health.
Oh, he's got a point there.
Well, and so some of that, though, there's environmental health and all of it's health, right? So part of it is trying to figure out how do we integrate. The side quick question is, and it's probably a different topic, but has there been a strategic plan for information? Like, what do we feel would be great to educate, to raise the level of health and decrease the morbidity and mortality of chronic disease, or whether it's from like contaminated wells or healthy conscious living and eating choices, or all of that stuff. Has there been a strategic thing, or has it more been a reactive? The media asked for this, if there's a flu increase, more reactive, or is it more of like, hey, has that been a thing, or is that something we need to do at some point, is to create an actual strategic information plan to try to build education on those important things?
I would say it's been a combination of both. We have our own information messaging that we want to push out that's pertinent, and then also some issues arise and we're requested to provide input.
Mm-hmm.
All right, speaking for myself, and Duke, I appreciate your perspective there. and I don't even disagree with you, but I still like Peggy's modification, just so that we respect domains.
Mhm.
And that's sort of reflective of, again, this bifurcation of the job description and whatnot. It is still saying, acknowledging that Eric is the boss, and while your point is strong, well, what isn't health-related in a health district? Well, I guess you're right. I really can't philosophically disagree with you, but from a practical, organizational, day-to-day operation, if I'm a PIO person, I want to know, do I go to that man, for that matter, that man, or that man? Well, by putting Peggy, oh, I'm sorry, Kim.
Or that woman. Yeah.
All right, Kim, all right.
Yeah.
But by putting Peggy's modification in there, it nuances it. And I get the spirit of what she's
No,
trying to do.
and that's fine. I'm just trying to bring up the point that a health district has to do
No,
with
I get
health.
it. Does anyone else want to weigh in on this topic?
Yeah, I was going to say, under that decision-making authority, the first bullet,
Uh,
I would, why can't we just modify it to say, through coordination with the health district director, has oversight and administrative authority over these things?
Oh, I love it.
Another.
I love it. And it's actually going to mirror what was set up above. I like it. Thank you. Is there anyone who does not like what Glenn just said?
Just so we know, other than the video, how are we tracking all of these changes?
Yeah, who's keeping track?
I'm taking track, and Jessica is, and we're going to come out.
We're
I've
gonna
already.
have a read back.
No, I'm going to have a read. No, we're going to put this in words, and it's going to go out to all of you guys in the next. Well, we're Thursday, certainly by Monday.
Okay.
So you're going to have plenty of time to ponder it, and then Tim makes a very, very cogent point. This entire discussion may be moot if we don't get a green light on the budget. So that's just a reality. Okay. I like who made the suggestion on. Oh, you did. Okay, right. In other words, it has to be not just in collaboration with, but in fact the approval of the district director. I got it. Anyone dislike Glenn's language? Okay, make it happen, Jessica. Okay, keep going, Glenn.
Okay, that's pretty much it, other than the final bullet that was crossed out.
Oh, yes. Oh, yes. Thank you. And wait, you said something that was germane. You would have even modified that language. What was your point?
No, I think just adding it back in. The one other
Go ahead.
question that I had is on this, other duties as assigned by the Board of Health or its subcommittees. Do the subcommittees have authority to assign tasks
No.
outside of the board?
No. What are you talking about? Are we here or here?
Well, it's this one, it's above decision making, but it speaks.
Oh, thank you. Cross out or its subcommittees. Thank you for pointing that out. Absolutely, cross that out.
I would.
Other duties as assigned by the board.
I would say if it's also been clarified that the medical director works for the director, that it would include the director and or the Board of Health.
Fine. Fine. And that's in keeping with, if you will, the two commissioners, current and prior. Okay, and I agree with that.
So as a last point under decision-making authority, are we reinstituting that, or are we is that just going to be followed anyway? Or, I mean, in other words, if there's a disagreement, if for example, there's a strong disagreement, it ultimately has got to come to the board anyway, right?
I like it being clarified in there that the board is the ultimate arbiter of any
Correct.
disagreement.
No, and we're going to replace staff with district director. That was the point you made.
Mhm. Right.
So here's what we're going to reinsert with Eric's modification. Should differences of opinion arise between district director and medical director, then the manner of resolution will be for not staff, but for
For
them,
issue, for the,
for them to take the issue to, I see, we had it nestled.
Yeah, it's a little
Oh,
bit
I see.
convoluted there.
Okay, we can leave it between staff and medical director, and then what we're going to do is add you as another sentence. And should there be a difference? Okay, I get it. Leave this sentence just as it is. Add a new sentence, a brand new sentence that says, and should differences of opinion arise between district director and medical director, then the board makes all final determinations. Are you happy with that?
Yeah, it could be argued that if the medical director works for the director, then
If he could appeal it to the board.
yeah. But I'm fine working within the confines of this. I want to make sure that I would expect that Greg and I can work together on items, and if it comes to a significant point of contention, I would certainly welcome the board's input.
Well, yeah, it's in your best interest.
Absolutely.
right.
Yeah, I that's common sense.
Yes.
You're in survival mode. You don't want to make waves.
Mr. Griffin, we have a hand.
Yes, sir.
So if I could make a suggestion, you guys are making bylaws for the future.
Yeah.
So Eric someday may not be here, or
And
Dr. Pinnock.
Greg may not be here.
Right. So you want to spell things out clearly now.
Yes.
Not just because these two work well together now, but in the future, there may be a change and you don't want to have to come back and do another bylaws change. So I would clarify that. And if the medical director works under and for the district director, then maybe the word appeal might be appropriate. That there's an avenue for him.
I think
He's
it's
not
appropriate.
satisfied with what he's getting from the
I see what you're saying.
I think it's appropriate because we're trying to do
I
it
think
for
I got it.
all relationships
So
change. and
basically,
so,
what we've said is staff has an appeals process,
Mhm.
and now you're saying that, in effect, the medical director is staff, and he too has an appeals process.
Mhm.
I got it.
Right.
That's an excellent point.
Yeah.
So therefore, the word appeal is going to be used in the event of a dispute between district director and medical director. Then either party may appeal. Oh, well, he's already staff. I mean, I could. Well, we've already said. Okay. Oh, I'll tell you what. Between staff and directors.
Yeah, broadened out a little bit, but
Does that satisfy your condition?
is it,
Tim, you're a director? Well, whatever. I don't know.
quick
Are you
question.
happy with that?
Eric, is there another area, because this is still under the medical director, is there another area where this is applying globally to the whole Panhandle?
Well, I think that you had mentioned in one of your emails, the problem-solving process. If there's an employee that takes issue,
Mm-hmm.
then that's how that is elevated up the chain of command.
Right, but ultimately it should be able to go to the board if needed.
Mm-hmm.
Yeah.
Right. I mean, I think that there should be an avenue for the medical director in a health district to be able to go to the board, so it doesn't have to go through you to go to the board, because you can always say no, right? Yeah. So I think there should be direct access.
But I like the idea that, let's say, Jason, God forbid, would disagree with Eric.
Mm-hmm.
He needs a path of appeal also.
Mm-hmm.
Without clear retribution.
Mm-hmm.
Well, okay, now, yeah.
No,
sure,
but
we have-
I mean, we're granting that
Yeah,
by
we're
putting it
granting
into the
that.
bylaw.
And I think that's what Ron Korn is getting at. It better be clear regardless of individual
Well,
personalities.
I think the idea without fear of retribution is important to put in there, because that is, again, you're spelling it out very clearly for,
Mm-hmm.
because again, this is like, hopefully they won't need to be changed for 5 or 10, 15
Mhm.
years or something.
Mhm.
So hopefully,
We do have a whistleblower policy, and we do have policies. to
Okay,
do
so
it.
let me give you some proposed language that attempts to incorporate the sentiments that have been expressed to date. So, should differences of opinion arise between district director, comma, medical director, comma, and other positions within the organization of leadership, then the manner of resolution will be for the disputing parties to take their issue, or to appeal the issue to the PhD board. And the PhD board makes all final decisions. Is everyone,
And without retribution, I think.
well, there's already whistleblower provisions.
Okay.
But whistleblower is
Okay,
different
so-
than disagreement. So whistleblower is more like I'm witnessing something illegal going on.
Well,
I'm
then
gonna let
that's a
somebody know.
disagreement.
That's different than
All right, do you want,
yeah.
okay, then determination, appeal without retribution. Okay, appeal without retribution. Does that make everyone happy?
It's safer, it's more protective.
Tim, are you happy with this language?
Yes, that's fine.
Peggy, are you happy with this language?
Could you repeat that?
I knew you were going to do that. Jessica, did you take it down?
No, I think she wanted to repeat the question.
Okay,
Are you
all right,
happy
here we
with
go.
this language, right?
I'll do the best I can. Should differences of opinion arise between district director, medical director, or other individuals in leadership position within the organization, then the manner of resolution will be for the parties to take the issue, or to appeal the issue without retribution to the PhD board, which will make all final determinations.
Yes, I agree with that.
Yes.
Mr. Chairman, I believe we have an appeals process where the employee goes to HR and then the HR individual starts the process.
I got it. Okay, and so we're going to, okay, and as we have recently understood, because of the sensitivity of, shall we say, the statute of the directors here, we're going to leapfrog HR. We already have a precedence on that, and I'm not going to say anything more than what I've just said. So there is a reason we're going to leapfrog HR. I mean, I'm not sure Sandy wants to get between these two people, to be quite honest.
You could say appeals will be made in accordance with district policy, because you already got it.
I mean,
Well, I think it's a unique.
Christine,
section
in
there,
all
yeah.
due fairness, we're not going to be talking about low-level things here. If there's going to be a dispute between these two people or their successors 5 years from now, it's probably going to be of merit.
So pardon me.
Yeah.
For clarification then, this discussion is specific to these two higher level positions, not rank and file.
Okay, well, here again, you're expressing an opinion that's different, but I'm agnostic. I've heard other people say that others should chime in. I don't know. I'm agnostic.
So my understanding is that the current system is more like if there's a interpersonal problem or a workplace personality issue or stuff like that that are more HR specific related things, that there's the current process for going through that versus a administrative decision level making disagreement. And so this is an administrative decision level disagreement process, which is different than the normal like HR. I don't like how someone said something or whatever. So does that make sense?
So it's a decision-making issue on a process or a procedure where potentially these two positions do not agree.
Yes.
Then it
Correct.
goes to the
Correct.
court.
And
Yes.
the way,
It's not an HR issue.
Right.
Exactly.
Right.
Not a basic
It's
HR.
almost like a messaging to the community or procedural which is a board issue.
or a direction of
Christine, let me
a
ask you a
program
question.
or something.
You bring up a very cogent point, by the
Yeah.
way. Very cogent. Because the current language uses the word opinion. That opens up the whole world. All kinds. So why don't we substitute that word for policy? Now that really does leapfrog Sandy.
Policy or procedure.
Okay. Well, okay. Or procedure, fine. I'm happy with that.
Which one are
And
you
you bring a
referring
good
to?
point, because opinion could be, oh my goodness, I don't like your tie today.
Yeah.
In which case Sandy really does need to weigh in. So we do not want to be bothered by what clothing you're wearing. I once had we ran a clinic, and there was an employee who was wearing low-cut dresses, and frankly, there were people who felt that that was not appropriate. And so HR really did get involved. I don't want this board to have to get involved in what women wear. Okay, so how about that in the spirit of what you were bringing up, Christine? Okay. Okay, so policy or procedures. Anyone disagree with Christine's friendly amendment? Okay. Anyone else want to add more language to this reinserted dispute resolution language or provision?
I won't know until I see it.
Okay, and in the spirit of both Glenn Bailey and Peggy, we're going to buff up the language. We're going to have a version of it. It's going to go out to you. Why don't we say, I'll tell you what. Why don't we say post Wednesday?
Okay.
There's no sense in spending a lot of time and the commissioners shoot down the clinic program.
Well, no, I don't think that's what's on the chopping block. I think this is something that would be desired to
Well,
be
I
moving
don't know
through.
what's on the chopping block.
Yeah. Do they do line item veto?
The chair of
stuff,
the
or-
meeting next week is Commissioner Matari. He's a businessman.
Mm-hmm.
The only feedback I got from Commissioner Matari was he said, well, gentlemen, you were prepared for your presentation. That's the
Good, sir.
only feedback I got. Now, he is a businessman. I do not read his mind. We will find out next Wednesday. That's just a reality.
So my thought is that this stuff supersedes whether or not it's fully funded or not. Like it's something that would. It's
You know
not
what?
dependent
If we don't get funded, we'll come back and we'll start all over. Because a lot of what is there to direct if there's no program? I mean, we're going to have to rethink the whole thing if there's no program.
But at the same time, the commissioners, they don't see that we have a policy bylaw that states this.
Oh, that, in
Then
five,
there's a big
well,
question mark for them.
in five presentations, not a single commissioner, out of 15 commissioners, not a single one asked, do you have the requisite bylaws to
No, but
carry out what you're doing?
but I have heard of a well-known commissioner from Bonner have mentioned that it's important for support that we make sure that we are
Okay, I tell
willing
you
to
what.
provide.
All right, we'll put out for publication the language that we have. Should one of the commissioners say, have you made the requisite changes in your bylaws to reflect this program that you're imagining? I'll say, well, gentlemen and ladies, here is our most recent version.
Most recent draft, yeah.
Here's this is the most updated version that we have, and we'll have it I'll have it ready to hand to them. If the issue should arise, I don't think that issue is going to arise. I think it's going to come down to money. But it could. Any other comments to make? Yes, sir.
So just for clarity, the chair is intending to take today's minutes and notes and suggestions to make a new document, new red line document, provided with the original bylaws, using a red line to strike out anything that you're wanting to take out and adding red lettering for everything that you're wanting to add.
Correct.
So I make a motion to reorganize the thing based off of today's discussion so that we have an accurate document to work on that's up to date. And then are we considering a legal review on that? Because that seems to be the consensus on some people.
Agree on it before we.
Yes.
Yeah. So then
Yes,
we
on legal.
so we want to then come back and then review it and see if we agree enough on it. Then after a little bit of deliberation, potentially, we could then send it to legal. That was a long, not very
We,
concise.
the last time we sent bylaws to legal, They told us you don't even need a medical director.
Do we have?
So not all legal
we have-
opinions are equal.
Not at all.
So that, to say we need legal begs the question, what legal?
Oh,
Who?
100%. Yeah.
If we send it back to
Do we-
Laura at Lake City's Law, she'll say, well, you don't even need a medical
Well,
director.
no,
Why are you even doing this?
The law, the legal that I think that would make most sense would be someone specifically at the state level or in the county level that can check and say, does it go against any known statutes? Basically, we're just checking because we have the ability to make the policy. So as long as it's not against a statute, we have the ability to make a policy. So it's kind of pretty clear. Idaho Risk Management made that very clear. So we just need to check, is it against any statutes? As long as we're not violating it, anything that's specific, we can make it. We can do it.
Do we
So-
currently have legal?
Sorry, was that Peggy?
Do we have legal? Yes. Do we have legal counsel currently?
Well, we do for a specialty item.
Okay, but not for other.
We do not have
items.
general legal. I could ask that same law firm if they, as a separate issue, just as a standalone separate issue, would they mind reading this document and seeing if there are problems with it? But I would need authority to do that. I'm not authorized to make that request. All legal expenditures have to be approved by the board.
Correct. Well, and certainly if we're going to bring it up on the agenda the next month, we can have the action item for legal on there at that time.
Or it could be made part of Joel's motion
Mm-hmm.
and get legal opinion.
Yeah, it is.
Oh, you
So-
did? So.
So I don't, maybe they
and
just
do you have
restate it
Do
clearly.
you have a fiscal note on that? How much money do you want to spend for that legal opinion?
I would say $2,000 maximum.
$2,000.
So,
That's
but
part
the,
of the motion.
the idea is we reorganize, clean up the document so it's at the most recent understanding from what we've talked about today. Send it out whatever day you choose, Chairman, so that everyone can review it. Once, if everyone goes, okay, I'm okay sending this to legal. If there's any concerns, we could always do a phone call meeting to just talk it over, and then send it to legal. So, of which we're going to determine which legal person we want to work with.
Well, unless we determine that right now, I don't know what direction to go in.
Well, I mean, I think we have a maximum amount, and I'm okay with the same law firm, or we go to the county and see if we can get the county to chime in on it. Kootenai County,
Well, this is a law firm that had been recommended by
Idaho Risk Management. Yeah.
risk management. It's always going to be safest to go with.
Well,
the
you know,
risk
that's an
management
interesting
recommendation.
point you make, Duke. Actually, since we're talking about stuff that would have
Idaho
risk
statute.
manifestations, go with the very firm that
Mhm. Okay.
Idaho Risk Management recommended. Well, that's an interesting point.
Okay.
Well,
So-
then, why don't you then,
Recommend that we go to Davila Law for a separate agreement from our current agreement of up to $2,000 retainer that we to get this figured out once the final copy that we agree on.
okay, do I hear a second?
I'll second that.
Any discussion? Roll call vote.
Glenn Bailey,
Yes.
Peggy Cavala,
Yes.
Dr. Johnson,
Yes.
Dr. Nolan,
Yes.
Commissioner Bertling,
Yes.
Chairman Fletcher.
Yes. Wow, I want to thank everyone. And by the way, just so much more thought was put into this language in the last hour or so than the so-called mysterious medical subcommittee ever dedicated to it. As a matter of fact, I'm so remiss, I didn't even notice that the resolution piece was
Serious.
gone. So thank you to everyone for making, I think, positive observations. Next agenda item is report on annual budget. Oh, me. I've already reported on it. We made our presentations to all of the commissioners. Appropriate questions were asked. You know, I don't know. I'm not a mind reader. We'll find out next Wednesday.
Can I ask one quick question on that?
Uh-huh.
Maybe Christine, just with our ask from, say, Kootenai, that's my group. Was it, how were we compared to last year on our final number? Was it the same or a little different or?
As far as Kootenai County, I don't have the numbers in
Okay.
front of me. Their allocation went up slightly.
Okay.
I remember slightly. I don't think it was significant.
Okay.
And that's based on the population and
The formula.
It's based on the formula,
Okay.
which is on population and assessed property value.
And is some of that because we had increased needs due to like capital
No,
improvements?
It has nothing to do with that.
No.
It's based on our annual ask, which was $2.2 million.
Okay.
And we did not increase that ask this year.
Because when I looked at the master budget, it looked like we were 100,000 less in the ask than the previous year.
Yes, but we asked the counties 2.2 million. You did the presentation
Yeah,
this year.
it's the same ask as last year. The reason that Kootenai County is seeing a bit more is because of changes in the other 4 counties. So they saw, in some cases, slight reductions based on population or valuation in Kootenai County.
$6,200 is the dollar amount.
Okay. No, I was just saying that it looked like when I looked at the master budget that when I compared to last year's ask, it was like about almost 100,000 less.
If you're looking at the total budget.
Oh, I was looking at the Kootenai County line. So yeah,
Kootenai County line.
the vertical column over Kootenai County.
Oh, that's the Kootenai.
I can maybe talk to you later about it. And
Yeah, let's do
I
it.
think you were looking at the general support for Kootenai County
that probably
for
was.
this facility.
Yeah.
I
Okay.
believe. We can look at it.
In the
Yeah,
spirit of
later.
economy of
Thank you.
time, can we
Yeah, move on.
proceed?
Yes. Thank you.
Please.
Thank you.
Okay, all hazard mitigation plan? Eric? Oh,
Thank you,
this-
Chairman.
Oh, there you go. I'm sorry, sir.
Yeah. So, Chairman Fletcher, ladies and gentlemen of the board. My name is Mike Throckmorton. I am your Health District Emergency Planner. Yes. So, yeah, if it's really terrible, we have a plan for it. I guarantee that for you. I'm here in that capacity to request the board's adoption of the Kootenai County Office of Emergency Management's All Hazards Mitigation Plan. So each county has an all hazard plan. They have an emergency operations plan. We have an all hazards mitigation plan. That's a requirement to receive any federal grant funding as a part of response and recovery efforts. So I was a member of the team that worked with Kootenai County and the other partners to create that plan. That plan has been accepted and adopted by Idaho Office of Emergency Management, and they have asked us as one of their partners to formally adopt that plan as well as members of that county.
So that was my question, was that you worked with OEM on this? Because I saw that Panhandle Health was put at the top of everything, but that's with the blessing of OEM then. Okay,
Absolutely.
got it.
Yeah, the state has already looked at it and approved the plan.
Got it.
Accepted it as is. It's a very impressive plan.
Mhm.
It's also 276 pages.
Mhm.
If you'd like to get that, I can get you a copy of that. We are only mentioned in it in the part that I played in the threat, hazard, and risk assessment. And then our portion as what we see as Panhandle Health District's Chapter 55. It's about a 4-page blurb of what we see as our risk assessment as members of that county, which I think you have in your packets.
Is there any conceivable reason we should not?
No, there is no negative thing that can possibly come from this.
Yeah.
What this
That's how I
enables us,
see it.
what this enables us to do really is if there is an emergency where an element of Panhandle Health District was impacted by an event and the county requested funds from the feds, we would be rolled up into that.
Well, it's a motion item. Do I hear a motion?
Mr. Chairman, based on the testimony provided and the information provided, I move that we approve resolution number 2026-1, resolution of the Panhandle Health District authorizing the adoption of Kootenai County multi-jurisdictional all hazard mitigation plan to be signed by you as the chairman.
And I'll second that.
Any discussion? Actually, I'm going to make a comment. You remember what happened in East Palestine a few years back? There was a train derailment and some really bad juju was spilled. And there were critiques of the biohazard response. And it got political awful fast. I distinctly remember about 5-6 years ago, there was a train derailment on US 95 right in front of the Vista farm, you know, that big farm. Now, as it happens, the cars that derailed were carrying corn. But what if it had been hazardous material? Bad things can happen, and we have a lot of trains up here. So kudos to you, kudos to your organization. Let's move forward. Thank you.
Yeah, we have a tabletop program scheduled in early June, so.
June 10th. Yeah, it's going to be phenomenal. Cuda County is doing an interaction between a train and a semi truck.
Yeah,
Right.
there you go.
And Matt, we're going to be walking through steps then, so.
Yeah, it's phenomenal team at Emergency Management for Cuda County. And yeah, it's going to be a great exercise.
All right, thank you, sir. All right, next agenda item, number 9, Dr. Pinup, I'm going to make a,
We presented that.
we presented what?
We have to vote on the,
Oh, that was discussion. I'm sorry. Roll call vote. Thank you, thank you. Roll call vote.
Glenn Bailey,
Yes?
Peggy Cavallo,
Yes.
Dr. Johnson,
Yes.
Dr. Nolan,
yes.
Commissioner Bertling,
Yes.
Chairman Fletcher.
Yes. Okay, I'm sorry, I apologize. Medical Director's Report, Dr. Pinup. For the sake of economy of time,
Brief.
very brief. We've already talked about you a lot.
Most of the time we've spent over the past couple months has been in relation to putting together budget presentations in the different counties with Dr. Fletcher, Eric, Christine, and myself. Thought they went very well. Ashley Johnson is a nurse practitioner that started recently, doing very well, getting her credentialed. And a nurse practitioner student who's started and working for us. We're looking at July schedules. Eric and I had a discussion about PIO interviews. We've actually completed the PIO interviews. Both of us have been part of each of those interviews. They went very well. We have some excellent candidates. And the only foreshadowing I want to give is perhaps next board meeting, I want to discuss fee schedules. And we're in the process of updating our fee schedule to cover our costs. And we may be asking the board to approve a change in how we set our fee schedules. That's not entirely clear to me yet. We're still in the process of analyzing the data, but just to give you a little forewarning. Otherwise, everything's going well in clinic, and that's my report.
Thank you, sir. Any questions for Dr. Pinup? Okay, hearing none. Discussion, moving expenses, sign-on performance. This is an action item. Actually, Christine, I think, called me one day, or somebody called me and said, there had been discussion of using a bonus or moving expenses as an incentive to hire some of these nurse practitioners. I remembered a conversation, but I don't think we voted on it. I checked with Jessica in the minutes, and we had not. It's queued up for a vote. Is this something we want to spend money on, yes or no?
Mr. Chairman, one thing to add, and Greg, correct me if I'm wrong, but I believe that if the budget is passed, those are built into the FY27 budget. So I think the time frame we're talking about is between here and the end of June. Is that a fair?
So moving expenses, sign-on bonuses are built into the 27 budget. Performance bonuses aren't part of that. We did talk about recruiting expenses too, and they are in the budget, but performance bonuses are a separate issue. The other three are included. So I'm not sure that it's worth talking about a period of time between now and July 1st.
Okay, then I would propose we table. Although I will entertain any motion you want. Go ahead.
Brief explanation of the
Yeah,
performance bonus concept.
sure. And that would be a discussion for you all to have at some later time. But the performance, basically, performance can be measured by one common measure in the private sector would be number of patients seen, and the high volume, high earners would get some kind of bonus based on the amount of volume of patients that they see. There's other ways to judge performance, quality, and other things, and that would be something for everybody to work out. Yeah.
As as someone who's aware, as you are, of the budget that's available, and that it is incentivizing and helps to keep good employees, and you're well aware of the finances associated, I would move that we include performance bonuses in there, knowing that he's already got budget limitations. It's just allocating his ability to reward those that are doing a good job, which would keep good employees and reduce costs of finding new employees. I think it would more than pay for itself, so I would move that we include that in the performance bonuses here in the budget.
So just the question, is this considered a best practice?
Is it considered best practices? I would say it's considered common practice, and it's more the norm in the private sector than not. Our model has to balance a revenue neutrality that we're trying to achieve with making sure that patients are getting adequate time spent with them, and that necessitates a balance.
Peggy. All right. Peggy has some questions.
Go ahead, Peggy.
I just want to make sure it was unmuted. I'm familiar with the practice of, productivity incentives and bonuses, and I've seen it work, and I've seen it sometimes not be successful in that occasionally a provider sometimes can just expect the bonus. So sometimes I think it's hard, definitely I think if you have strong benchmarks for what exactly are we doing? Is it productivity? I mean, I think it needs to be defined. And the only other thing is there any concern about that being an issue for other staff when they're not given the same opportunity, so to speak?
I think it should be well defined, no doubt about it. And how we do that, I think, is a discussion.
And Chairman, if the board would like to review the compensation policy of the health district, it does outline pay bonuses or different reasons to give pay increases. So it is well defined. If you want to review, if you believe the changes are appropriate, then we can certainly review those. And key item that we always look at, though, is can the budget afford it? Not necessarily is it called out in a given budget, but do we have the funding available to do that?
So is there a current bonus structure like globally?
It's fairly general, but largely it doesn't exceed. Is it $2,000 per?
All right, so I'm going to make again, this is a germane topic.
Mm-hmm.
I'm going to go back and say more homework needs to be done.
Mm-hmm.
I'm going to make, again, a suggestion that we table it, and I'm going to make a suggestion that Eric and Sandy and Dr. Pennock put their minds together and come to some common sense notion of what performance means. It's going to, the board members are out of it. You notice I'm not I'm keeping us out of it. Bring to us some kind of a plan. Christine, am I leaving you out? Should I include you? You're looking at me so pitiful. Come back to this group with more meat on the bone, with something flushed out. Because Frank, I mean, Peggy's point is absolutely good. I mean, my old group, we struggled with this all the time. Because if you put too much performance payment predicated on performance, then the quality of the performance is in jeopardy. You just run through. You're going too fast. And if the business is to spend time with patients and to help them, you can be counterproductive. So there are perversions. I acknowledge them. There are perversions, but maybe we can work out something nuanced that is meaningful. Okay. I've said my piece. I need a motion.
Do we move
of some
to
kind.
move to? I don't know if "table" is the right word, but move to have the administrative staff work this out more details and come back and present it at subsequent board meeting for what the exact proposed concepts are in addition to current policies for performance bonuses.
Fair enough. Do I hear a second? Any discussion? Roll call vote.
Glenn Bailey,
Yes.
Peggy Cavalli,
Yes.
Dr. Johnson,
Yep.
Dr. Nolan,
Yes.
Commissioner Bertling,
Yes.
Chairman Fletcher.
Yes. All right. Next item is, I guess, something having to do with conservation districts. Dr. Nolan, again, for the sake of time,
I'll be quick.
because the hire is going to take a lot of time.
Okay.
So I
So
don't know what other board members' current time parameters
this is
are.
from my other hat, as I'm a supervisor on the Kootenai-Shoshone Soil and Water Conservation District, and so we're currently the conservation districts in North Idaho that are in the Panhandle and all over the state. We run the aquatic invasive species check stations primarily for boats and all that stuff coming through and transiting through Idaho. And so currently there's some significant crisis going on in Western United States and even all the way out to like Minnesota and Lake Michigan. It's primarily the quagga, the zebra, and now the golden mussel. The golden mussel is the scary one. Like everyone's scared of the zebra mussel, but the quagga, but the golden mussel can release. It can get off and reattach, and it's like a little portable thing. With the risk to North Idaho is that anywhere this has happened, and recently it got introduced, golden mussel got introduced to, I think, the Sacramento Delta via transport, and it's worked its way almost 300 miles south into the aquifer, California aqueduct, and it's come up to at least the Oregon border. And it's also, so the idea is that Kootenai-Shoshone, we cover Washington to Montana on the I-90 corridor. We also have a few side ones coming into the state from Washington. And so our partners up in Bonner have been doing their part, and they also guard from coming down from Canada. And so one of the things was that there was a budget-related decision that shut down if everyone's familiar with Samuels north of Sandpoint, that was the primary southbound boat check station that has basically collecting, basically supervised. It was a beautiful station, lots of room for boats to back up, but all of the large Canadian boats that come down quite significantly. The problem is not Idaho boats. The problem is boats that are promiscuously going to other waters and coming back to us or coming through us and then dropping in and all that stuff. So this is not an Idaho boat problem. This is a problem with boats going elsewhere or coming to Idaho for fun. And so the idea is that boat check station shut down. It was kind of like our only main southbound from Canada to check. In Canada, usually boats are quite large, usually 30 feet or more. So they have lots of compartments and all that kind of stuff. So what I would like to do is being that so what is the danger? Just real quick. The danger is a shutdown and a lockup of the entirety of all irrigation systems and all creeks and all water inflows to every lake, including Coeur d'Alene Lake, all the North Lakes and Boundary, Bonner, every county. I have a list I can send out to everyone that I've accumulated. All of the main lakes, all the inflow creeks and all the outflow creeks, all the outflow rivers. And basically, if it gets here, it's a destruction of property value. It's a destruction because if you think about if the lakes are infested, cities can't draw water almost out anymore. They're constantly fighting it. So all the golf courses that tap into the rivers, their piping will get filled up with mussels and get damaged and destroyed. It's pretty catastrophic. And so currently, we don't want this year to be the year that it gets here. And so the idea is that I think as the Panhandle, I would like to see if we could have a support letter of reopening the Samuel Station immediately. And we lost some very senior inspectors that have been, some of them had been with us for, I think, over a decade because they didn't get rehired due to the shutdown of the station.
Does this have a fiscal note?
Yes. So it costs about $22,000 a month to run that station. They originally were getting it through an MOU with Idaho Department of Ag. Department of Ag, for not clear reasons, shut down that MOU for the Samuel Station. And that they basically turned off the cash. And so there's no money to fund it currently. So there's multiple options. There's interested parties. One of the ways would be looking at realtors that are representing the people that are on the lake. Those people don't want this destroyed because basically it will mess up their entire happiness on the lake. And then all the farmers in the area, and then us as part of managing, doing septic and wells and things like that kind of fits within our, to a degree, not exactly, but it's in our entire territory. So,
Joel?
Yes.
Joel,
Yes.
I think I need to address this issue with you.
Great. Thank you.
With the board.
Thank you, Tim.
Currently, Samuel's Station, that has now been we have now a boat check station above, 3 mile above Bonners Ferry that is checking all Canadian boats, all Montana boats, and north and southbound, where the Samuel Station was only checking boats going southbound. So now we have actually a more effective boat check station above Bonners than Samuel's actually was. And it's catching the Montana, and it's also protecting the Kootenai River because there was no boat check station that was catching those boats before they might enter Kootenai River. So I wouldn't agree with that assessment for the Samuel Station. It'd be a redundancy.
Thank you, Tim. I appreciate that. The assessment so far of the districts was that the new station, it's in an inopportune location that's across a highway, and so boats that are now probably 45 to 60 foot long vehicles attached with a trailer will have to turn left across oncoming traffic in order to get to it, and you can't actually visibly see the new site that's there from the highway. And so already drive-bys is an issue, and then if it's like I might get hit by oncoming traffic because it's a pretty big corridor, I might just try to see if I can sneak by. And so there is an issue. I agree with you that Samuel Station was not getting incoming Montana traffic for sure, but it was the ideal location for the southbound Canadian traffic. And so the new one it's a danger actually for the boats to cross over the highway coming south. If going north, it's fine.
I don't agree with that assessment.
Okay, that's fair. That's fair. I'd be willing to look at that more, for sure. But I totally appreciate your input. We're looking at it from having to manage this all over. So I don't want to take too much more time, but the idea is that, Tim, have you guys looked at as far as your drive-bys and your how much flow you're getting through there coming from the southbound specifically, not just Montana?
I'd have to talk to the person that's running it. I have her number and I can talk to her. The thing is, what you're talking about turning into there, that's a moot point. We have semis turning in there all the time.
Mm-hmm.
And if they do have to miss it, they can go down the stoplight, take a left, and loop around back in off a stoplight to go to that station.
Okay, so then because that's pretty new, right? Just how long has that one
Yes.
been? It's been like the last couple of weeks, is that right?
Yeah.
Okay.
It takes a while for people to catch on to it.
Yeah, so I was thinking though the The idea too is in that area that there's something called sign fatigue that the Idaho Department of Transportation talks about. And so that's also a sign fatigue area, that there's a lot of signs in a short period of mileage. And so that's another part of that being a potential challenge. We run into that on the station coming in from Montana on I-90 coming west, is that there's a lot of signs there because you're coming into the state and there's different towns in Kellogg and all that. And so the idea is that that's also a sign fatigue area. It is a bit dangerous. The semi trucks are, I mean, they're used to stopping every time they transfer over to another station. They have to get weighed and all that stuff. But so that's my concern. I'll go with my concern, and then I appreciate your input too. I think it's something we need to study more of, but it's been a long established station that was very easy to get into, and so that's my concern. But I appreciate it. Thank you, Tim.
Any other discussion?
So is there a law enforcement issue location as well?
Yes. So most of the time there's an MOU with the sheriff in a given district that to go back and do pullbacks, what they call like bringbacks or something like that. A lot of times the sheriffs are too busy or if they're on another call, so they usually can't dedicate a specific sheriff to the site. But whenever the sheriffs are available, they'll come in and be at the site. So it really kind of depends on that. But part of it is it's just such an incredibly critical issue that kind of the average, like the average person that's not studying that issue, when you start studying it, you know, usually the people's faces go white with what it means. So it's just something that I think that I would like us to be more involved with because it's particular to our area. And also we could potentially sometimes get forgot up in the northern waters because we have such a different water environment. And so if Pend Oreille gets infested, there's really no treatment for it. It's 1,000-foot deep lake in places. So the treatments that happened down on the Snake River in the last year, and actually year and a half, wouldn't work there. And plus there's so many different species and there's the bull trout and there's all kinds of stuff that would you'd just be mass slaughtering to try to take out the other stuff. So really the only main solution is to prevent it from getting here if at all possible. So it's something that I just wanted to bring up. It's I wanted to see if we get support for, I think ultimately, Tim, I think both stations is the appropriate answer. That'd be my thought. It's not a one or the other. But I just know that drive-bys is a really big deal. And if it's hard and you have somebody that's coming in and maybe they got kids in the back and this and that, they're like, oh, yeah, I got to pull over across this double lane road and I think I might get hit. I'm just going to go. And so that happens fairly often, or they just see it as too late and they don't realize that they can do a loop around and all that stuff. So those are some of the areas.
This agenda item does come with an action item. Do you want to make a motion?
Yeah, I mean, I'd like to make a motion to support the potentially studying the reopen of the Samwell station and encouraging the reopening of the Samwell station.
How do you define support?
A letter saying that the Panhandle supports the Samwell station as a major defensive point for the waters of North Idaho.
Is there a fiscal
there doesn't have to be
your motion?
There does not have to be. There could be. There does not have to be.
I will let that ambiguity rest. Is there a second on the motion?
So to the conservation district, is that who the letter would be addressed to?
I think it would be to the interested parties, which includes IDWR, it includes Idaho Department of Ag, it includes the Idaho Conservation District. There's the state Idaho Conservation District Association thing. So I know it's unusual. We don't normally cover this, but it's something that happens like every day right now. There are boats coming in and it's beautiful weather coming. And so it's something that's coming our way if we don't defend against it. So
okay.
it's kind of
Peggy, do you have a comment?
I do. So again, I'm the process person, and I
Thanks, Peggy.
am always trying to understand how things get put on the agenda and how things get put on the agenda for action. And, you know, I'm not saying I'm opposed to this, but what I would prefer is if, again, I'm only hearing about an item in the middle of a meeting, I would prefer background information ahead of time. And it seems like as a full board, we should be weighing in to whether something is an action item.
That's very reasonable, Peggy. It was something that I came to awareness of at last Wednesday, and including we were talking about the golden mussel issue, which is aggressively moving our way. It's already at Oregon, Southern Oregon. And so then I asked the chairman if I could.
Actually, I have
And he said
an
I could put it on.
apology to make.
Yeah.
We entertained a motion and
Oh, yeah.
we went into discussion before getting a second.
Oh,
So
true.
at this moment,
True.
I'm only interested in a second on the motion. Do I hear a second?
I'll second that.
Okay, now we can have discussion. Thank you.
And
All right.
if I may, based on that, oh, well, it's Peggy first. Go ahead, Peggy.
Oh, no, I said my piece.
My only thought is if all we're doing is asking for these regulatory agencies with the state to relook at, reconsider, please study this, I don't think that we're
No.
putting them out a whole lot. And
No.
so,
I mean, ultimately, I would like to work on setting up a joint support of the station, even if the state chooses not to reopen it, such that we, as the people that are appointed either as commissioners or as by our commissioners to help with the health, because it would massively affect the waterways, the access to water. I mean, you're talking probably hundreds of millions of dollars of impact in both shore property values would plummet, and then also the revenue from our tourism that we love.
right,
would
but
drop as well.
your motion was
Yes,
to
right.
contact these organizations and to request that they do what?
That they reopen the Samwells station pronto.
So we're, okay, so it's a request for them to study and reopen based on the need. So it's not just a one county issue. It's a reaching out to the state and the Department of Ag, et cetera, et cetera.
For sure, yeah.
So I don't see that there's anything wrong with reaching out to them to request that they reconsider the funding that they had dropped. For example, the Department of Ag. I don't know why that's. I don't
Yeah.
see that as being a negative to request them to pay attention to that. Unfortunately, I have been in New Zealand and saw how that devastated the streams of New Zealand, and I would hate to have that occur to Idaho. It's horrible.
Any other discussion?
Yeah, I just want to.
Currently, our boat check station has checked 272 boats, and that's both ways. And it's picking up.
Yeah, we're just entering the season. And I'd like to say, I don't understand why we can't have cameras out there that can identify vehicles pulling boats when we do facial recognition all the time. Why can't they pick up a boat and notify the check station, there's a boat coming? The threat is real. It seems like we should have the technology to deal with it. Anyway.
It's a good point. Any other
Point.
discussion? Yes, Commissioner Corn.
If I may, sorry. So I'm not up to speed on this. I'm aware of it. I believe that it's funded through boat registrations and such. It's not funded through the counties at all. So I don't know if we would be in support of funding anything through PhD, because that you're coming back on the counties for this again versus where the funding should be coming from. And then there's always the issue of the number of boats that we're missing at these check stations because they're not open 24 hours a day. So you're catching a percentage and maybe a high percentage of the boats that are coming through in all of these areas, but you're not catching 100% of them. So I don't know how to move forward as far as risk versus benefits, money versus, we could throw millions of dollars at this, and all it takes is one boat coming through at 2:00 in the morning, intentionally or unintentionally, and now we have the problem.
So that's an additional issue that we've started to discuss is really the extremity of the problem can never be oversaid or overdone. Like the economic devastation that's occurring elsewhere where it's already happened. So like there is the extreme option of saying no more boats outside of Idaho allowed into Idaho. And then we just say, if you come here, we're going to let you rent a boat. And that would be the only way to probably for sure, basically, it's not an Idaho boat problem. It's a problem of boats going out and come back. If the Idaho boat goes out and goes to Lake Mead or goes to another place and then comes back, then it's a boat problem from Idaho. But the idea is if it's a boat that's in Idaho, they're not going to cause the problem. So the only way to actually lock it down would be to not allow boats coming in. And one of my colleagues from Shoshone on the Soil and Water Board had brought up the important thing of considering even float planes being an issue, because float planes tend to be very promiscuous in the waterways. Where are they getting checked, right? And so again, it's something that's so critical to the well-being it's coming. And so either we stop it or we don't stop it, but it's coming. And so, and we have such, So, and the thing is that I think in down south, it's more of like the Snake River's not that deep. They can do spot treatments locally, and a lot of times they're going to do pretty good. They did pretty good with the previous treatment when that happened down in Idaho Falls area. But the government, they spent, I think, over $16 million doing it. And that was just one time, and then they had to retreat it the following year. And so if you look at the preventative cost on that, I don't know if Jason has any ideas on any input on that or not, but but yeah. And North Idaho waterways are not treatable that way, which I don't think they're treatable because we have deep lakes that are big and lots of water. And so again, Tim, I'm thankful that your station is rocking. But I think it's not covering the whole thing. And like you said, it'd be a 2 a.m. boat crew, and we've had an issue with boat haulers because a lot of times when people have fancy boats, they don't drive their own boats anywhere. They load them up and they were on the thing, and then the boat's locked, and you get there and it pulls in random times, and then the truck's got 3 or 4 big fancy, $400,000 to $800,000 boats on it. He doesn't have the keys to any of them, and so they can't actually get in there. And I know people that like wakeboarding. Wakeboarding boats are the biggest offenders because they have massive tanks, and so really, the idea of wakeboarding boats are probably the biggest likelihood of the risk, because if you have an old ski boat that doesn't have tanks that pull things in and out, well, you just look and just make sure that the plug drained at the last place and that there's nothing on the motor, and you look around, it's easy. But the modern boats, it's a big deal, and so it's a problem. So,
Any other discussion?
Peggy has her hand up.
Okay, Peggy?
So is it my understanding that the Shoshone Soil and Water Conservation District was the ones that made the decision to close this?
No, Peggy, that was Idaho. It was an independent Idaho Department of Ag decision. It didn't affect directly the Soil and Water Conservation District for Shoshone Kootenai. I think it was a Bonner. So Bonner has their own independent Soil and Water Conservation District. And so it was a station that they managed from the Department of Ag. Our stations are still fully open. So it's more of it's not my territory, but as a Panhandle, it's in our territory. And it's also the land that I love, that I want to take care of for our future generations and our kids and grandkids. And so that's more why I'm bringing it forward, because it also does fit within the area of influence of the Panhandle.
My AI search must be incorrect.
Sorry, what was that?
Any other discussion? Well, hearing none, I'm going to make a point. Look, I'm morally in support of this, of a letter, but I would request of the motion that we disambiguate PhD's fiscal responsibility.
Yes.
It is too late in the season to ask PhD to put forward any monies towards even the most wonderful project imaginable, particularly when Tim may well be correct that it's duplicative services. So at this juncture, I'm all about writing a letter in support, but I am not in support of our budget underwriting any of it. So we have to, for me, I will vote no unless we disambiguate our fiscal connection.
How would you like that disambiguated?
Say we will write a letter in support and not provide any financial support in support of the project, but PhD does not have the resources to contribute funds.
Fair enough.
That's what I would say.
Does that need to be restated or no, or is that?
I would, and I'd have another motion and a second, and then we'll talk about that.
Okay, but with the current motion, do we just?
I do have another question. So just on the process, historically, what do we normally do as a board when letters of support are requested?
That's a good question. It's never occurred for me before here, so I don't know, Peggy.
Glenn or Tim?
Yeah, it's a good point. Actually, I don't know. Do you want to table this?
Not really.
It's okay. Well, it's late in the day.
The
We're
muscles
fixing
aren't,
to
I know the
lose,
muscles aren't tabling themselves, so that's.
All right. Well, are you going to restate the motion?
Yeah. I would like to make a motion to that we support the I would like to say the reopening. I know Tim doesn't agree with me, but the reopening of the Samuel Station as the main southbound checkpoint from Canada for AISs, which is aquatic invasive species.
And currently, PhD does not have the financial resources.
And PhD is not willing to fund that reopening.
Fine. Do I hear a second?
Second.
No more discussion. Let's have a roll call vote.
Glenn Bailey,
Yes.
Peggy Cavallo,
No.
Peggy,
Oh, I couldn't hear. Or I don't know what's going on. Can you hear me now?
Yes, we can hear you. It was a roll call vote, Peggy.
Okay, so where are we at?
We're voting on it, and you've been called to vote.
Just for a letter of support.
Just for
no
a letter of support. No financial, just a letter of support. No financial involvement.
I'm going to abstain until I totally understand, our role in writing support letters as a board.
Dr. Johnson,
Yes.
Dr. Nolan,
Yes.
Commissioner Bertling,
No.
Chairman Fletcher.
I'm perplexed. I'm inclined to vote. I guess so. Yes, but it's just for the letter of support. Okay. Yes. What's the
So we
split?
have 4 yeses, 1 no, and 1 abstain.
Okay, motion passes. Next item. I think we go into executive session. So I would like to keep Eric and Greg for this discussion.
Chairman, quickly, did we move those items below the director's report? I mean, I don't have anything to report, but I think we did move it below 14, is that correct?
Mm-hmm. Correct.
Yes.
So, and I had nothing on the director's report.
Okay. There we go.
Thank you, Eric.
All right. So let's go into executive session, and I'd like for district director and medical director to stay.
So, Mr. Chairman, I make a motion that we go into executive session pursuant to Code 74-206, subparagraph 1, subparagraph B, dismissal or disciplining of, or to hear complaints or charges brought against a public officer, employee, staff member, or individual agent of public school.
Fair enough. Do I hear a second?
Second.
Okay.
Chairman, I think
I know.
we need,
I got it. Let's just move on. You're right. You're technically correct.
Got it. Roll call vote?
Does this require a roll call vote?
It does.
Okay, roll call vote.
Clint, Peggy Cavall. Peggy, would you like to vote to move into executive session?
Yes.
Dr. Johnson?
Yes.
Dr. Noland?
Yes.
Commissioner Bertling?
Yes.
Chairman Fletcher?
Yes. All right, we're now in executive session. I need to so the issue is who to hire as a PIO. And just
No, actually, you can just.
We
come
need to
out
be
of
on the record. We
executive.
have voted to be on the record.
Well, no, so Glenn,
Well, I guess we need a roll call vote.
Yeah, Glenn
to
seconded
come
it.
back into meeting.
Who made it in the second?
Glenn, I think.
Yeah, go back into,
To go back into,
And who was the second?
Joel and Glenn.
I motioned and Glenn seconded to go back into regular session.
Thank you.
Thank you.
So roll call vote.
Glenn Bailey,
yes.
Peggy Kabala,
Yes,
Dr. Johnson,
He left.
Dr. Nolans,
Yes.
Commissioner Bertling,
He left.
Chairman Fletcher.
Yes, we're back in session. Do I hear a motion?
Mr. Chairman, based on our discussion and the results of the interviews that have been performed, I make a motion that we authorize the director of the Panhandle Health District and his Sandy move forward as discussed.
Yeah.
With the select-
Move forward as discussed. Yeah,
With the PA, the public information officer.
right. And do I hear a second?
I second that.
I was
Any
going to second.
discussion? Roll call vote?
Glenn Bailey,
Yes.
Peggy Kabala,
Yes,
Dr. Nolans,
Yes.
Chairman Fletcher.
Yes. Do I hear a motion to adjourn the meeting?
Motion to adjourn.
I'll make that motion.
Oh, go for it, Peggy. I'll second that.
Okay. Any objections? Hearing none, the meeting is adjourned. Thank you, everyone.
Yeah, thanks.
Wow, and Clint. Excellent. You did actually what needed to be done with those bylaws language. That you see the accusation was made that somehow or another the subcommittee was some